Okay. Okay, for question number 1, wait lang. May heard naman, no? Audible naman sa lahat. Walang problema sa, ano. Okay. Kita lahat ng sulat ko? Okay?
Yes po.
Kita? Okay. Sige. Okay, for number 1, in fluorometry, the secondary light source has a longer wavelength than the primary. The primary excitation source is, what is the answer? Letter? Ano kayang sagot? Ultraviolet, UV. Okay, so for number 1, it's ultraviolet. Okay, again, dito sa fluorometry, di ba siya yung gumagamit ng ilang monochromators? Kaya nga yung secondary, primary, ilan?
Dalawa po.
Dalawa po.
Okay, dalawang monochromators. And then, sa kanya din yung quenching. The term quenching. For quenching, increased temperature is equal to decreased fluorescence. Okay, yun yung quenching. Okay, next, number 2. Which lipoprotein primarily transports exogenous triglycerides? The answer is letter exogenous. Chylomicrons. For number 2, it's letter D, ano ba yan? Letter D, ano ba yan? Chylomicrons. Okay, again, the richest among these 4 choices. Alin dito yung richest in phospholipid and protein? Again, it is the HDL. Ang ginagawa niya is reverse cholesterol transport. So, ang HDL, it transports the cholesterol from tissues to liver. Kaya nga siya yung good cholesterol kasi hindi sa tissues niya dinideposit yung cholesterol. Unlike itong ating bad cholesterol na LDL, by the way, ang isa pa daw pala tandaan dito para matandaan na good cholesterol si HDL kasi may H siya, so mayroon siyang halo. Yun. Sabi lang ng iba. I don't know if na-adopt nyo din yun or baka ano din sa inyo. And then for LDL, it forwards the cholesterol transport from liver to tissue. So, ano naman, baliktad. Yan, kaya tayo nananaba kasi mga cholesterol, dinadala ni LDL sa tissues. Ayan, kaya nagkakaroon tayo ng mga adipose tissues, fatty deposit. And then, VLDL, this is produced in the liver. And then it is the major transporter of, if exogenous si chylomicrons, VLDL is for endogenous. By the way, itong exogenous, since it's exo, so from external source, it is also termed as dietary. So yung ating food intake. So external source yun ng ating triglycerides. Pero ang endogenous is brought about by VLDL or the very low density lipoprotein. Okay, and then ang ating chylomicrons, it is produced in the intestine naman. Intestine. And this is responsible for the milky plasma. Masyado bang makapal yung aking tinta? Wait lang, bawasan nga natin. Masyadong makapal. Okay, for the milky plasma. And then, it forms a floating creamy layer. Siya yung creamy layer. That's why Chylomicron is creamy. Yan. Creamy. Si chylomicrons. Okay. So number 2 is letter D. Number 3, which apolipoprotein present on VLDL and chylomicron remnants serves as the ligand for LDL receptors of the hepatocytes? So the best answer for number 3 would be letter D again. ApoE. Okay. Ano ba tong si ApoA1? This is a cofactor for lipoprotein lipase. Lipoprotein lipase or LPL. Di ba siya din yung major structural protein for HDL, di ba? Si ApoA1. And for ApoB100, it is the major structural protein naman ng LDL and VLDL. Pero ang tanong kasi dito is the ligand for LDL receptors of the hepatocytes and chylomicron remnants. So the best answer would be letter D. Okay, and then si ApoB48 naman, ito yung kay chylomicrons. Okay. Okay, number 4, 10% contamination with a 5% glucose solution will elevate the glucose in a sample by, okay, umuulan ng D. For letter D, it's 500 milligrams per DL. Pero dun sa aking isang source, ang 10% contamination daw ng 5% glucose solution, i-elevate niyo yung glucose by 500 grams per DL or more. Yun yung nakalagay. Yun yung sakto nakalagay. Or more. So, tandaan nyo na lang since 5 nga nandito. And then, yun yung sagot. 500 milligrams per DL. Actually, I haven't researched yet kung ano ba yung naging computation dito. But, if you know, syempre, pwede nyo naman ding sabihin sa akin or i-present. Pero, ito kasi yung parang standard na, na sinasabi or information regarding the glucose contamination. Okay, for number 5, which represents the principle of uricase. So uricase is for plasma uric acid. Number 5 is letter A, enzymatic UV. Okay, bakit enzymatic UV? Okay, kasi ang ginagawa ng uricase, it converts uric acid to allantoin. Okay. And ang UV peak absorbance kasi is 290 to 293 nanometers. But allantoin does not absorb at 293. Okay, so a decrease in absorbance, which is a decrease in absorbance is proportional to the concentration of uric acid. So yun yung principle niya. Although i-discuss din naman later. Okay, so for number 5, it's letter A, enzymatic UV. Okay, number 6, which is not included in the computation for LDL. The answer is letter A, VLDL. Ano ba dapat yung computation? So, LDL is equal to total cholesterol minus HDLC minus plasma triglycerides divided by 2.175 if Ito ay if millimole per liter. And kung ano naman, kung what do you call it? If milligrams per DL naman, so tag divided by 5. Okay. So wala naman dyang VLDL. Okay. Pero kapag kukunin mo yung VLDL mismo, how would you compute for that? So VLDL is equal to triglyceride divided by 2.175. Okay. Number 7, which correctly pertains to the first order kinetics for enzymatic assay. So, ang palatandaan dito, di ba, is Zephos. Zephos. So, if it is first order, so the answer is letter. Anong sagot?
Letter D.
Reaction is directly proportional. Okay, so the answer is first order. It is substrate is in excess. Okay, so substrate dependent. So letter B. Ayaw wait lang ha. Letter B. Okay. So Z for zero order enzymatic or enzyme kapag first order substrate. So substrate is in excess. Okay. For number 8, the range of electromagnetic spectrum where visible light falls, it's letter C, 400 to 700. Again, paano kapag UV light? Ano yung kanyang electromagnetic spectrum? Is
Less than 400.
Less than 400 nanometers. And then, more than 700. Tama ba? Or baliktad? Tama? Okay. UV and then more than 700 is your infrared. Okay. So, yun nga, yung 4 mukha siyang umbrella. So, yun yung UV. Sorry, medyo malat na si ma'am. Okay, number 9, conversion factor of IgD. So, mg per DL to mg per liter. So, ano kayang sagot? It is letter B, 10. Okay, saan ba nanggaling yon? So, kung mapapansin nyo, ito nga pala yung mga conversion factors natin. If I were you, you should compile them, yung mga conversion factors, mga list of CDC reference method, mga CLSI reference method, i-compile nyo na yon para isang tinginan nyo na lang, madali nyong maaaral and madali nyong matatandaan. Madali nyong gagawa ng mnemonics or anything that you would make your life easier to memorize them. Okay. So, ito. So, saan naman papatak dito si IgD? So, IgD, remember, di ba, isa siyang immunoglobulin. Therefore, an immunoglobulin is a protein. So, dito siya sa protein. Total protein. Okay, you have there 10. Okay, so for number 9 is letter B. Okay, number 10. What is the recommended fasting time for triglycerides and LDL? It is letter C, 12 to 14 hours. So, And for fasting venous plasma, di ba, it's 8 to 10 hours. Pero yun nga sinabi ko sa inyo, kay Dean Rodriguez, yan, pwede na daw sa FBS or FBG yung 6 to 8 hours na fasting. And then 14 to 16 naman, this is over fasting na. So, hindi na pwede. Inaccurate na yung magiging result. Okay, for number 11, the transport protein of copper. It is letter copper, apo, ceruloplasmin, or simply ceruloplasmin. Now, what is this GC globulin? Ano ibig sabihin ng GC globulin? So this GC globulin, this is also known as, if you have read your notes for the second lectures, this is a vitamin D binding protein. And this falls under, alpha 1 globulin. Kaya nga siya GC globulin. So, kasama siya sa alpha 1. Okay. And then for apotransferin or transferrin, transport protein siya ng ferrostate of iron. Ayan, ito na, Fe. Or hindi pala, Fe. Yan. And then for haptoglobin naman, this binds the alpha chain of hemoglobin. Kasi di ba, if there is hemolytic anemia, what is the what did we call it? The predicted level of haptoglobin in hemolytic anemia. Ano sa tingin nyo? Increased or decreased? Hello, increased or decreased? Kapag may hemolytic anemia, from the word hemolysis, hemolytic, nag-burst si red cells. And hindi lang isa, kundi madaming red cells. Si red cells, pumutok. Ano ang nilabas ni red cells? Hemoglobin. Again, para sa ng haptoglobin? This is a part of a salvage system ng ating katawan para ma-save si hemoglobin. So, binabind niya yung alpha chain. Remember, di ba, may 2 alpha and 2 beta chains yung globin part ni hemoglobin. So, nagbabind doon si haptoglobin para ma-reuse siya ulit ng katawan. Therefore, kung madaming hemoglobin yung lumabas sa circulation or outside of the red cells, what do you think would be the level of haptoglobin in the blood? Anyone?
Decrease po.
Decrease po.
Okay, decrease. Bakit? Kasi lahat sila or majority ng haptoglobin, mababind niya si hemoglobin. So, haptoglobin, so ibabind niya si alpha chain ni hemoglobin. So, forming the haptoglobin-hemoglobin complex. This complex is too large para ma-filter ni kidney. Kasi nga, di ba, pinaka-basic, ang ating katawan ay nagre-rely sa homeostasis. Kailangan mo syempre, kapag nabawasan ng hemoglobin, di ba, hindi magiging magandang effect nun sa katawan mo. So, ano magiging, kumbaga, salvage system ng katawan mo? Ibabind ni haptoglobin, si hemoglobin, forming this complex. Kung hindi siya lalabas kay kidney, ibig sabihin, marireuse siya ng katawan mo. Okay? And then, yung mga free haptoglobin, what do you think would be the level? So, yun nga, decrease. Kasi nga madami silang na-bind na hemoglobin. So, therefore, hindi na free si haptoglobin. So, mababa na yung magiging result ng free na haptoglobin in the blood. Yun lang. Okay, so for ceruloplasmin naman, ceruloplasmin, ano kayang level niya sa Wilson's disease?
Decreased po.
Okay, decreased ceruloplasmin. Ibig sabihin, walang transfer or lessened ang transport protein of copper. Okay, wait for a while. Okay, number 12. Principle of direct Jaffe reaction for creatinine. So the answer is letter A, calorimetric endpoint. So ito si direct Jaffe. Ano yung kanyang reaction? So creatinine, so syempre galing to sa sample or sa serum. Plus, ano yung ating reagent dito? Alkaline nitrate or picric acid. 'Di ba sa ating, kumbaga sa general knowledge natin ng picric acid, ano ba yung kulay ng picric acid? It is parang yellowish na reddish, 'di ba? And in this case, it will result in red-orange tautomer. Yan, yung sinasabing red-orange tautomer. Okay. So number 12 is letter A. Okay, number 13, in which of the following enzymes is a decreased plasma concentration clinically significant? What is the answer for number 13? Answer? Anong sagot? Anyone? Yes? Letter? Tagal. Letter D, cholinesterase. Remember, ang ating enzymes, they are clinically significant when they are increased, di ba, in the plasma concentration. Bakit? Remember that your enzymes, back to basic tayo ng cell biology. Saan napoproduce ang enzymes? Saan? Sa rough endoplasmic reticulum. And parang ang storage din niya is sa lysosomes or lysozymes. So, kapag nagkaroon ng destruction of tissues, anong magiging tendency ng enzymes? Lalabas siya sa plasma, thereby causing increase ng enzymes in the blood. Ito na nga yung mga examples like CK or the creatinine kinase, LDH, AST. But in cases of cholinesterase, mas clinically significant siya. Okay, wait lang. My apologies, wait lang, saglit lang. Okay, sorry for the delay. Okay, let's continue. Okay, as I was saying, cholinesterase, bakit siya mas clinically significant kapag decrease? Kasi, ano nangyayari dito? In cases of insecticide or organophosphate poisoning. Ano nangyayari kapag mababa yung level ng ating cholinesterase? Tataas yung level ng acetylcholine. Although yes, this is very important for our sa ating neurons and the muscular muscular function. Pag nag-build up ang acetylcholine, it can cause spasm. Ano pa? Excessive lacrimation. So anything na hindi maganda or anything na sobra, siyempre masama, like this one. Kasi ang nag-maintain yan to a preventable level is yung cholinesterase. Ay ano mangyayari kung madidecrease siya? Siyempre, magkakaroon ng build-up ng acetylcholine. So, kaya siya considered na clinically significant kapag lessened ang level ng cholinesterase. Okay, next, number 14. The enzyme used to assess pathologic condition of the biliary tract, except okay, the answer is letter E, none of the above. Bakit? Kasi lahat sila ay used to assess the pathologic condition. Okay, another tip in answering mga tests ninyo. Kapag may mga nakalagay na except, or all of the following except, bilugan nyo na agad. Kung kunyari, physical paper naman yan or physical test paper, yan, ibilugan nyo na. Tapos, focus kayo dito sa except. Kasi yan yung mga nakakalito. Like, paano kapag medyo lutang ka, tapos nagsasagot ka ng exam, hindi mo napansin yung except. Paano kung maliit yung sulat ng except, so hindi mo na napansin? Baka mali ang mapili mo sa mga to. But in this case, lahat ng enzymes na ito ay used to assess the pathologic condition of the biliary tract. So itong A, B, C, and D, they are called the canalicular enzymes. Kaya nga canalicular, so dun sa duct. Yan. Ang palatandaan ko dyan dati, di ba? LAP, ALP, GGT, 5NT or 5 nucleotidase. Okay. So may 5, I don't know kung magiging wali na naman to sa inyo or what, pero bahala kayo kung anong gusto nyong gawing mnemonics. For canalicular, may 5 taong nakasakay sa Alps na bus. IgG, lumampas napunta sa kanal. Yun, bahala kayo kung anong gusto nyong gawin, pero actually para may contribution din si Sir Lee. Kaya natandaan ko. But it's up to you again. And then for cytoplasmic enzymes, we have AST and ALT. So, anong palatandaan dyan? So, cast. Wala pala. So, basta, itong dalawa, yung AST and ALT. So, bahala na kayo dyan. Cast out? Okay, anyway, kung ano yung inyong preferred. Okay, for number 15, which of the following represent the parts of the positive displacement pipette? So for number 15, the answer is shaft, disposable piston, and disposable capillary. So alin yun dito? And piston seal. So piston. Okay, so letter is shaft, disposable tip. Okay, so shaft, piston, capillary, piston seal. So the answer is letter I don't think na may air caution pala dito. So, wait lang. I think it's letter C yung nasa answer key. Pero double check ko to ha. Kasi ang alam ko walang air caution. Okay, double check ko yan later. Wait. Okay, for number 16, the danger of kernicterus is a certainty at what bilirubin concentration? It is letter C, 20 milligrams per dl. Next one, which of the following plasma protein is an indicator of malnutrition? That is letter D, transthyretin. Kaya nga siya transthyretin, kung hihimayin mo yung words niya, transport, thyroxine, retinol. Okay. In other term, this is also called as pre-albumin. And pre-albumin is an example of a negative APR. Okay, next, for number 18, in high-resolution electrophoresis, plasma proteins are separated into how many bands? So, in cases na hindi kayo familiar or may tanong na parang hindi ko alam kung ito ba'y naaral namin or whatnot. So, ang isang tip din dyan, tingnan nyo yung word. So, high resolution. So, ibig sabihin kung high resolution, mas specific yan. So, ibig sabihin, mas madaming bands yung mafo-form niya. So, the correct answer will be letter D, 12 bands. So, di ba yung normal, ano lang naman natin, serum electrophoresis or what do you call it, SPE. So, di ba meron lang naman siyang albumin, alpha 1, alpha 2, beta, and gamma. So, kung bilangin mo 1, 2, 3, 4, 5. Pero kung sa CSF electrophoresis, di ba nag-exist din yung sa pre-albumin? Siya yung nauuna, di ba? Kaya nga before pre-albumin, and then followed by albumin, alpha 1, alpha 2, beta, and gamma. Okay, for number 19, a moderate elevation of 3 to 5 times in total LDH is seen in letter B, megaloblastic anemia. Megaloblastic anemia. Again, saan nga ulit pinaproduce yung HCl and intrinsic factor? What cell?
Parietal cells.
Okay, parietal cell. So together with HCl and intrinsic factor or Castle factor. So this is for the metabolism or absorption of vitamin B.
B12.
Okay, B12. Okay, for number 20, which type of water is used in the preparation of standard solutions? You have their standard solutions. Kung standard, ano dapat ang water na pipiliin natin? So, naka-highlight naman na dito, it is type 1 water. Again, for type 1 water, so mga standard solutions, yung mga ultra, ano pa ba, measurements at a nanogram, sub-nanogram. Ibig sabihin, napaka-accurate dapat na magiging measurement that there should be no chance or no interferences na makikita or mahahanap dun sa mismong solution. And then ito, nakalagay ng tissue or cell culture method. Siyempre, bawal dyan ang interferences or contaminants. And then for type 1 water, dito nyo din makikita, or ito din yung ginagamit for reconstitution. Ano yung reconstitution? Ito yung pagtitimpla ng, for example, controls. Diba? Sa clinical chemistry, lalo na yung mga nagjo-duty dyan, ang ginagamit dapat na type 1 na water for constitution is type 1 water. So yan, yung mga pang low control, high control, diba? Yun dapat yung ginagamit. And then for type 2 water, again, diba si CHIM? So chemistry, hema, immuno, microbiology. And then type 3 is for washing. Okay, so most procedures in your analysis, parasitology, washing glasswares. Okay, next, number 21. Pregnant women who had gestational diabetes mellitus are at risk of developing type 2 DM within how many years? 5 to 10 years. Again, what is the diagnostic marker for GDM? What is the diagnostic marker? is GTT or glucose tolerance test or the glucose challenge test. Okay. Next, number 22, hyper. So, number 21 is letter B. Sorry guys, medyo parang mababa yung energy ni ma'am kasi nga yung boses ko. Sorry na. Okay, number 22, hyperlipoproteinemia phenotype associated with increased chylomicrons. So, ito yung ratio natin. Okay, from this ratio or this table, what is the answer? It should be type ano? Huy, guys, answer please. Hello?
1 po.
Okay, type 1, increased chylomicrons. Wait lang, nabanggit ko ba na may 3 vitamins tayo na nangangailangan ng chylomicrons? Hindi ko pa ata nabanggit. So, si vitamin A, E, and K, they all need chylomicrons or they are composed of chylomicrons. Okay. Next, for number 23, which of the following has no isoenzyme? Ano ba pag sinabing isoenzyme? So, meron pa siyang mga, kumbaga, parang mga subunits of enzymes. So, alin dyan? Alin dito? Sa 5. Sige, walang nasagot. Tatawag na lang ako. Mag-unmute ha. Apostol, Jenny. Apostol Jenny, hello, good morning. Please answer number 23. Okay, si ano na lang, si Yuang Charles.
Hello po.
Good morning, yes. Please answer 23.
Letter A po ate.
Sure ka na ba?
Hindi
Hindi
po.
ka pa sure. Okay, sige. At dahil hindi ka sure, sayang naman kung hindi yan yung sinagot mo, di ba? So, the answer is letter A. Tama ka. ALT. So, di ba, si CK or si creatinine kinase, meron siyang mga isoenzymes like CKMM, ano pa? CKMB, and CKBB. So, this is more for the brain, di ba, sa brain, and then ito sa heart. Kapag combination ng MB, and then MM mostly for muscle. So, alin yung slowest migrating? Ibig sabihin ng slowest migrating, the most cathodic CK isoenzyme. Alin dito sa tatlo? Sige nga, kung nag-advance reading kayo. Sige, I'll call someone else. Silva, Marjorie, Pearl. Miss Silva, which among these 3 isoenzymes is the slowest in migration? Ano ba pag sinasabi migration? Hindi sa electrophoresis. So, which one is the slowest dito sa tatlo?
CKMM po.
Okay, very good. CKMM. And then, si CKBB, siya naman yung fastest migrating. And then CKMB, diba? It is a specific marker for AMI. AMI stands for Miss Guse Maricon. Ano ibig sabihin ng AMI? Guse Maricon, hello, good morning. Ano ibig sabihin ng AMI? Okay, let's have Silva Ariadne. What is AMI?
Acute myocardial infarction po.
Okay, acute myocardial infarction. So remember, class, that your CKMB is the first enzyme and the third protein to increase after AMI. So, wait na. So, lagi niyong tatandaan si Mikal. Sino si Mikal? M stands for everyone. M stands for ano ibig sabihin ng M?
Myoglobin po.
Myoglobin. I stands for
Troponin I.
troponin I. And then C, yun na nga, CK, ano, MM, MB, or BB? CK, MB. And then A. Anong ibig sabihin ng A dito? Again, ito yung mga tumataas ha, kapag may AMI or acute myocardial infarction. Ito yung pagkakasunod-sunod. A stands for AST. And then the last, LD, yun na, sabi ko na. So L is for LDH. Okay. So for ALP naman, meron tayong 4 isoenzymes, diba yung liver, bone, placental, and intestinal. So for ACP, we have the erythrocytic ACP and the prostatic ACP. So from the prostate and from your erythrocytes or discocytes or normocytes or red cells. So yun yung mga synonymous terms for red cells. Okay, and then LDH, yun na nga, di ba meron siyang LD1 hanggang LD5. Okay, number 24. What is the enzyme classification of creatinine kinase, ALT, and AST? Ano ba sila? They are letter ano kaya ito?
Hindi po.
Di po.
Hindi po.
Letter B
They
po.
are, okay, transferases. Okay. Next. Next, number 25. This cardiac marker rises an hour after infarction, returns to its normal plasma level within 24 hours. So number 25 is, di ba nasabi natin yung Mikal? O sabi, rises an hour after an infarction. So yung pinakamaaga. This is myoglobin. Tandaan nyo ha, pag sinabing protein, first protein to increase, ang sagot dapat is myoglobin. Okay? Tapos kapag, what do you call it? For yung first enzyme na mag-i-increase, pag sinabing first enzyme na nag-i-increase for AMI, anong magiging sagot niya dapat? It is CKMB. So, depende sa tanong kung protein, kung enzyme. Pero tandaan nyo ha, ang enzyme is also a protein. So, it will depend on the question din. Okay, for number 26, symptoms of diabetes such as polyuria and polyphagia are observable at what plasma glucose concentration? Anong sagot dyan? Sabi plasma glucose. So the answer should be letter C. 205, di ba? Kasi kapag plasma glucose mo ay more than or equal to 200 mg per dl. So, di ba? Ano ka na yan? Diabetic. So, number 26, letter C. Number 27, methods for measurement ng serum glucose. Napakadali nito. The answer is letter B, Follin Wu and Hagedorn Jensen. Ano ba kapag si Carmen? Carmen method, that is for isipin nyo na lang si Carmen mahilig manood ng Game of Thrones. GOT. Si Gutman and Gutman, this is for ACP. For Blurs, this is the two-step principle for cholesterol determination. And then si Hans, saan siya? The non-enzymatic method for triglycerides. And then itong si Zaz. Ano ba itong si Zaz? This is for GGT. Again, anong klaseng enzyme si GGT when it pertains to the biliary? GG. Nalaglag sa saan? Hello?
Canalicular po.
Okay, canalicular enzyme. Okay, number 28. The most common type of monochromator is letter A, diffraction gratings. Number 29, screening test for amino acid dopamine is letter A, HPLC, high performance liquid or high power liquid chromatography. Number 30, conversion factor of ammonia. Anong sagot? By this time, dapat nagsasaulo na kayo ng mga conversion factors. What is the answer?
C.
Mr. Barrion? Okay, sige, nasagot na ng lahat. Letter C, 0.5872. Sino si 0.357?
BUN po.
Urea po.
Sino?
Urea.
Okay, BUN or urea. And then 0. Okay, thank you. 0.0113 is 4. Kaya nga may 3 na doon. 113, ano to? Triglyceride. And then 88.44.
Urea.
Creatinine. Kahit ganyan yung mga numbers or yung combination of numbers, di ba parang by this time, alam nyo na yung sunod-sunod nung numbers and kung para saan yun, like for this examples of conversion factors. Okay, number 31, functions of proteins except. So, lahat ito ay function of protein. So, what should be the answer? Letter D, none of the above. Siyempre, proteins, di ba? Ano ba ang building blocks ng ating mga proteins, di ba? Amino acids. And yun yung, kapag pinagsama-sama yun, di ba? Nagiging muscle or tissue. And then yung tissue nagiging organ and yung organ nagiging system. So yun, proteins. And then coagulation, yes, your coagulation factors are also proteins. And then osmotic pressure maintenance. What contributes to the osmotic pressure? Diba yung ating albumin? C, albumin, which is a protein. Okay, number 32, a renal test which is freely filtered at the glomerulus and then reabsorbed and metabolized completely by PCT. What is the answer? Letter B, beta-2 microglobulin. Okay, your beta-2 microglobulin. Sige nga, immunosero, medyo pahaging tayo. Beta-2 microglobulin is it part of the MHC class 1 or MHC class 2?
Plus 1.
+1 po.
Okay, so for MHC class 1, it is alpha and then beta-2 microglobulin, and then for MHC class 2 is alpha and beta. Okay, number 33, the early indicator of glomerular dysfunction. Early indicator considered. The answer is, for number 33, is letter B, microalbumin. So kapag more than 30 micrograms per ml na yung nagsisip out sa urine na albumin, so yan, it is an early indicator of glomerular dysfunction. Okay. So yung ating cystatin C, this is an endogenous marker of 4 GFR. Ano yung GFR? Glomerular filtration rate. Okay, number 34, the most important drug associated with hepatotoxicity. So this one is quite tricky kasi pwede niyong isipin na ethanol or aspirin. Kasi itong dalawa, they are both, anong classification of drugs sila? Anti-epileptic, convulsant. And wait lang, doon sa naaral natin sa carbohydrates, convulsants are hyper or hypo? Hyperglycemic. Okay, thank you for answering. But what is the answer here? Number 34 is letter A, ethanol. So yun. Ethanol. Number 35, the definitive method for serum cholesterol. What is the answer? It is letter C, Abel, Levy, and Brody. So letter C. Itong Van Handel and Zilversmith. Anong method ito? Para saan? Si Van Handel and
Triglycerides po.
Zilversmith is for... Okay, thank you. And then for Jendrasek and Groff is for bilirubin. And then Bowers and McComb is for alkaline phosphatase. Number 36, true of beta-gamma bridging and electrophoresis. Okay, ang dali lang nito. It is both of the choices. So, ang beta-gamma bridging is evident when there is hepatic cirrhosis. And kapag may cirrhosis, ano kayang level ng albumin? Kapag may cirrhosis, reversible pa ba or irreversible na ang damage kay liver? Reversible or irreversible? Pili ka nga, Mr. Ano daw? Yes, may sumagot na. Okay, 'di ba kapag na-reach yung 80% na capacity ng liver, 'di ba, your liver or our livers are capable of regeneration. Kaso, kapag inabuso at na-reach yung kanyang capacity or threshold na 80% of the liver should be, functional. So, kapag 80% ng liver function ay na-diminish, so magiging irreversible na yung damage. Hindi na siya makakapag-regenerate. And kapag sira na ang ating liver, anong magiging value ng albumin? There will be decrease or albumin will be decreased. Saan ba na-form ang protein mostly? Saan? Sa liver. Kaya alagaan yung mga atay nyo, wag puro wag puro inom, kayo mag-aral din. Okay. 36 again, so kasama din dyan increased plasma IgA. Ito magka-connect silang dalawa kasi there are evidences or studies na kapag may cirrhosis ay nag-i-increase ang IgA. Kaya IgA kasi mostly, 'di ba? Because of ethanol, kaya nga hepatotoxicity may kasalanan yan, alcohol. So ethanol. So, ang evidences dyan, nataas daw yung IgA. Nag-increase yung IgA in cases of chronic alcoholism. Or yan yung may kasalanan yung alcoholic cirrhosis. Yan. And then number 37, this test will strongly differentiate type 1 DM from type 2 DM. What is the answer? Letter D. Letter
D po.
dog. C-peptide. Bakit C-peptide? Again and again, ang ating explanation dyan for type 1 DM. Okay, ang sira niya mismo ay si beta cells. Kasi may autoantibodies that are destroying the beta cells of the pancreas. If sira ang beta cells natin, walang magiging production ng proinsulin. And proinsulin, diba, it's composed of your insulin and C-peptide. Kapag walang proinsulin, edi wala ding insulin and C-peptide. Unlike kapag type 2 DM, so okay naman yung beta cells, pero sira yung ating mga insulin receptors sa ating tissues or sa ating organs, sa cells, di ba? So, kung okay naman si beta cells, may production ng C-peptide. Okay, so explanation din kung bakit hindi ketosis prone si type 2 DM kasi nga tawag nito may available glucose naman. Sa type 2 DM, ang problema nga lang 'di ba is yung receptors. So hindi kukuha ang katawan from other non-carbohydrate sources. Unlike pag type 1 DM, wala talagang insulin. Wala talagang magdadala ng glucose into the cell. Diba? Yung ating glucose transporter. 38. This reaction measures nga pala, wait. Ang ethanol din, naaral din namin to dati and pinantake note. Ethanol is the most commonly used or commonly abused substance in United States and perhaps all over the world. So it's ethanol. Okay, number 38. Number 38, this reaction measures the formation of purple azobilirubin. It is letter C, Vandenberg reaction. Saan yung Feron reaction? This is for urea. Berthollet reaction is for, ito yung enzymatic na urea din. Pwede din sa urea. Then Zimmerman is for yung 17 keto steroids. Ano pa nakalimutan ko dito? Okay. Dito muna ulit tayo sa OGTT. Pinalagyan ng smiley dati sa amin ito. Paano daw kapag ang patient nagkaroon na naging nauseous and na-experience yung vomiting while taking the glucose load. Ano daw dapat yung gagawin? Anong gagawin sa pasyente or anong i-instruct sa pasyente? Mr. Sige, tawag ako ng name. Miss Amatus?
Yes po, ma'am. Ma'am, ano po
Amatus? Ha? Ano yung tanong ko?
magiging nauseous po after drinking po
Hello?
nung glucose load?
Yes, during the procedure, naging nauseous siya and then nag-vomit. Ano dapat i-instruct sa pasyente mo pag ganun?
I think papaulitin po yung pag-drink po ng glucose.
Kailan mo ulitin?
Not sure po, pero po kapag po stable na po ulit yung patient.
Okay, so ganito, uulitin mo siya the next day na kasi pwedeng makapag-interfere na yung, di ba, napainom mo na ng glucose, and then nagsuka. So, hindi na magiging accurate yung measurement. Kaya, parang most likely or pinaka-safe niyan is sa ibang araw na lang ulitin yung OGTT. Kesa naman, mali yung ma-release mo or hindi sure na tama yung may i-release na result. Okay, for number 39, in dry slide technology, the preferred method for using analyte is, or yung principle na dry slide is letter D, reflectance photometry. So yung light na na-reflect, kaya nga reflectance, yun yung mini-measure. Okay, number 40. The glycogen storage is characterized by the deficiency of 1,4-glucosidase. What is the answer? Diba si POM4. POM4. Si Corey Forbes, amylo 1,6. Si Mac Ardell, Mac muscle, phosphorylase, and then 1 Gerk, yung glucose 6 phosphatase. Okay, number 41. This type of automatic pipette functions like a hypodermic syringe and does not use disposable tips. Kung hindi siya gumagamit ng disposable tips, anong ginagamit niya? Capillary tubing. So, alin dito sa apat? The answer is letter A. Positive. Okay. Number 42. The substrate for the measurement of lipase activity, triolane. And then number 43, a patient with insulinoma. May malignancy sa beta cell, may exhibit dizziness and fainting attributable to hypoglycemia. Okay, share ko na din to sa inyo. Nasa sa inyo kung kokopyahin nyo or hindi. So, ang ating causes of abnormal glucose levels. Okay, so for hyperglycemia, for divided kasi yan sa persistent. So, ibig sabihin talagang tuloy-tuloy, hindi tumitigil, and then transient na at some point, magno-normalize din. So, yeah, naka-smiley face kasi to sa notes ko. Ibig sabihin nun dati, since yun, naging student kami ni Sir Dennis Magtibay of BAT MC, parang yun yung naging practice namin. Every time that there is something of importance, parang talagang nilalagyan namin ng smiley. Okay, so for persistent, syempre, pinakauna dyan, DM. And then, second one is cortical hyperactivity or adrenal cortical hyperactivity or yung ating Cushing syndrome. So, yun lang yun, Cushing syndrome. Third one is hyperthyroidism. And then, number 4 is acromegaly. And then, number 5 is, sorry naman, obesity. Yan, mga obese. Yan, hyperglycemic. Okay, so, okay, for transient, first one is pheochromocytoma. Next one is severe liver disease. Third one is acute stress reaction. Number 4 is shock. And number 5, convulsions. So, yan yung mga persistent and examples of persistent and transient hyperglycemia. Okay, what about hypoglycemia? Dito ko na lang ilalagay. Hypoglycemia. So, kapag persistent, so yet again, persistent and transient. Okay, number 1 is insulinoma. Oh no. Insulinoma. Second one is Addison's disease. Kung yung isa ay hyperactivity, this one is insufficiency. Adrenal cortical insufficiency. Number 3 is hypopituitarism. Number 4 is galactosemia. Diba may deficient enzyme dito, hindi niya ma-convert into galactose. And then number 5 is ectopic insulin production from tumors. Ectopic insulin production from tumors. And then for transient naman, yan, transient is, again, acute alcohol ingestion. So, nakakakos ng hypoglycemia ang excessive alcohol. Pero in the long run, nagiging increased yung sugar. Yan. Second one is drugs. So, ano yung mga hypoglycemic? Kung meron tayong hyperglycemic drugs like anticonvulsants, meron tayong hypoglycemic drugs. Ano ba yung mga yon? Like, example nito si propranolol. Di ba isa siyang beta blocker? Si propranolol, ba yung mga lol na dyan sa dulo? Yan, mga beta blockers. And then, ano pa? Si salicylates. Sino pang nakakalimutan ko? Salicylates, propranolol, anti-TB agents, yan, or anti-tuberculosis. Number 3, severe liver disease. Ano pa? Number 4, glycogen storage disease. Number 5, hereditary fructose intolerance. Fructose intolerance. Yan. So, nasa sa inyo kung kukopyahin nyo or ayaw nyo. Okay. So, yan. Hypoglycemia. And then, hyperglycemia. Okay. Nasa na tayo? Number 40. Ayun, yung isa pala, tama. PES nga pala yun, PES. So, propranolol, ito pala. Ethanol and salicylic. Yun pala yung nakalimutan ko. Pero nandyan na din naman. Okay, number 44. Increased blood ammonia levels may be associated with letter E, all of the choices. So, encephalopathy, neurological changes, and coma. Di ba ito yung sa Reyes syndrome? Okay, number 45. The amount of light absorbed, the more amount of light absorbed, the higher the concentration of analyte in this technique. So what is the answer? It is letter A, spectrophotometry. Diba? It takes advantage of the fact that colors absorb wavelength. So yan, spectrophotometry. Para saan naman yung nephelometry? Diba ito yung measurement of light scattered naman, or light scattered in an angle. So ano ba yung clinical significance niya? Detection of cryoglobulins. Saan ba evident ang isang disease or syndrome? Evident ang presence of cryoglobulins. From the term cryo, so malamig, and then globulins, proteins. Saan ito? Sa Raynaud's phenomenon. And Raynaud's phenomenon, anong autoantibody ang meron ito? It is anti-centromere. Kasi di ba si Raynaud's phenomenon, kasama siya sa CREST syndrome. Ano ba yung binubuo ng CREST syndrome? Calcinosis, Raynaud's phenomenon, esophageal dysmotility, ano yung letter S? Sclerodactyly, and letter T is for telangiectasia. Anyway, we'll be discussing that naman in immunosero. Number 46, decreased serum albumin levels may be associated with, so napaka-evident naman ng choice, napaka-obvious, decreased. Okay? So, all of the choices. Bakit kapag may kidney disease, decreased ang albumin? Kasi nga, syempre, kung sira yung kidney mo, mas madaming albumin yung napupunta sa yung urine. That's why the early marker for kidney disorder, kidney disease ay si microalbuminuria. Okay. Number 47, process by which fluorescence of an analyte is reduced due to the excited molecule losing some of its energy by interacting with other substances in solution is known as letter B, quenching. Sino ba yung may quenching? Saan evident ang quenching? Sa fluorometry. Yan, sa fluorometry. And then 48, the blood glucose increases rapidly by food intake and returns to normal level after ilang minutes. So, dapat marunong kayo ng conversion nito, ha? Malalaki na kayo. Minutes to hours, pwedeng seconds to minutes. So, depende sa magiging choices or given. So, dapat hindi na tayo malito sa ganyan or take time to analyze. So, the answer is 2 hours ay 120 minutes. Letter T. Okay, 49. An APR that inhibits enzymatic proteolysis. You have the keyword there. Kung nalilito kayo. The answer is letter A. Antitrypsin. Trypsin is a protease. Ano ba kapag sinabing protease? This cleaves or breaks down protein, kaya nga protease. Inhibits enzymatic proteolysis, anti-inhibits. So ito na, kung hindi kayo sure o mag-rely kayo sa choices. alpha-1 antitrypsin. Minsan sa exam, talagang diskarte kung paano mo mag-correlate. Kunyari, hindi mo talaga alam. And then, you have the keywords naman. Kaya nga sabi ko sa inyo, gagamitin nyo yung back to basic na principle. Kasi most of the time, pwede kayong maisalba niyan sa points. Okay, number 50. The function of major lipid components of the very low density lipoprotein is to transport. So, naulit lang yung tanong, di ba? Napakadali naman itong pre-eval. What is the answer? Number 50 is, di ba, VLDL, again, endogenous triglycerides. Okay. Okay, so we're done now in Rationale for pre-eval. Let's head on to our topic for today, which is, ano ba yung una? Protein and liver function.
Ma'am,
Yes,
diba?
ano yun?
Ma'am, makakahingi po, ibibigay niyo po yung soft
Yes.
copy po nitong ano.
Nung nakaraang MTAP, parang hindi binibigay itong copy na to. I'll ask permission kung papayagan, pero I do not think na dapat ay talagang nakinig kayo sa discussion and you take down notes. And syempre may recording naman, so you can go back kung ano man yung na-miss out nyo.
Okay po, thank you po.
Okay, thank you. Okay, sige, ano na tayo? Diretso na tayo dun sa ating proteins. So, wait lang. Stop share ko muna to. Okay, kita naman ng lahat yung presentation. Ay, wait, masyadong malayo na pala to. Okay, kita nyo ba yung buong screen? Ano nakikita nyo lang na sa audience?
Ang slide lang po, yun
PPT po.
na PPT po, title.
Okay, yung title lang mismo. Okay, sige. Okay. Okay, so we're about to discuss proteins. So from the Greek word proteis, meaning, wait. Okay, meaning first rank of importance. And proteins are amphoteric or ampholytic. It means it can be acidic or alkaline depending on the body pH. Okay, so they have zero charge, which is called Zwitter ions. So at less than 3.5 na pH, the proteins are cation ions. Another parang palatandaan, di ba? Para siyang nagpo-form ng heart dito. So kung mahilig ka sa cat, ayan. So yan, form ng heart. So less than 3.5 proteins are cationic. And then for more than 3.5 proteins are cations. Again, basic baka kasi nakakalimutan ng iba. Kapag cations, what is the charge of the ion? Positive or negative?
Positive po.
Okay ha, huwag kakalimutan. Alam ko namang alam na ninyo ito, pero 'di ba, sa dami ng inaaral ninyo, minsan nakakalimutan niyo yung basics. So cat positive ion, cation. And then anions, yun yung negatively charged. Okay, next. So, your proteins are macromolecules. So, ibig sabihin, yan. They are composed of covalently linked polymers ng amino acids. Ang, kumbaga yung, what do you call it? Yung basic structure ng protein ay amino acid or CAA. And then this is linked by peptide bonds. Okay. So, ang sabi dito, di ba, synthesized in the liver except for immunoglobulins. Bakit? Saan ba na-form si immunoglobulins? Sino nagsisecrete ng immunoglobulins?
Plasma cells.
Sagot kayo. Okay, plasma cells. And your plasma cells is the most fully differentiated B cell, si plasma cell. Okay, add ko lang din. Okay, di ba sabi natin kanina, in cases of cirrhosis, mababa yung albumin. Bakit? Bakit mababa yung albumin? Kasi si albumin is a protein. And protein, sabi dito, synthesized in the liver. So kung merong problema sa liver mo, di-decrease yung production ng albumin. So ganun lang kasimple. Severe or chronic liver diseases cause a decrease, yan, yung sinasabi ko, the plasma protein production. And yung proteins natin is composed of 50 to 70% ng dry weight ng ating cell. Okay, saan naman napoproduce? Saang part ng cell napoproduce si proteins? Anyone? Saan? Saan siya napoproduce? Anong part ng cell? Biology. Sa ribosomes. Okay, di ba meron tayong rough ER and free ribosome? Di ba kapag free ribosome, yung nakakalat lang siya all throughout the cell. And then si rough endoplasmic reticulum, yun yung syempre nasa reticulum and then yung may mga ribosomes nakakapit sa kanya. Yung pinoproduce na proteins ni rough endoplasmic reticulum, yun yung proteins needed by the body, yung ating mga body system. Kumbaga, tinatransport niya yung proteins outside of the cell para kailanganin naman ng ibang parts ng system. And for free ribosome, yun naman yung proteins na pinoproduce na proteins ng cell for itself. Gets? So this is producing proteins needed by the cell. Okay, next. Okay, we have the nitrogen balance. Diba sabi ko sa inyo last time, ano nga ulit yung chemical composition ni protein? Diba siya yung
Bonds po.
bonds. Ang pinagkaiba ni protein kay lipids and carbohydrates or glucose, siya ay may nitrogen. May nitrogen content. Okay. So kapag sinabing negative nitrogen balance, mas lamang yung catabolism kesa sa anabolism. Kaya nga kata, di ba? Excessive tissue destruction. So ito yung examples niya such as burns, wasting disease, high fever, and starvation. So more of yung breaking down of the protein. And then for anabolism naman, yun yung building up. Okay, so ito yung kumbaga lahat ng patubo. So growth, pregnancy, and repair processes. Okay, what is the medical term for high fever? Matanong ko lang, madagdag lang sa inyong vocabulary or what. So the medical term for this is pyrexia. Kaya nga may anti-pyretic. Like yung mga acetaminophen. Okay, so we have different kinds of amino acids. So kapag sinabing aromatic, ano yung mga examples na yon? Tryptophan, phenylalanine, ano pa? Tyrosine. Okay, and then for sulfur containing, we have cysteine and methionine. For acidic amino acids, we have aspartate. Kaya nga aspartate, suffix aspartic acid or glutamate or glutamic acid. And then we have the basic amino acids which are glycine, arginine, histidine, and lysine. And then we have the aliphatic amino acids, yung glycine, alanine, and si valine. Okay, meron naman tayong tinatawag na essential amino acids. So, ano ba tong essential amino acids? So, these amino acids are obtained from dietary sources. So, ano yung examples nun? Si seleno, cysteine, and lysine. So these two are examples of essential amino acids from dietary sources. Okay, next one for the 4 protein structures. By the way, wait, review lang ulit. What is the screening test? Again, screening test for amino acidopathy. Ano nga ulit method yon? Amino acidopathy. HPLC or the high performance liquid chromatography. Okay, thank you. Very good. Okay, for the 4 protein structure, pinaka-basic primary structure. So linear, nandyan na yan sa word na yan. And then it determines the identity ng protein. So kapag primary structure, nandiyan na yung peptide bonds. Kapag secondary structure, hydrogen bonds. So kapag secondary, it is the winding of the polypeptide chain. So it refers to the alpha helix, beta pleated, and bend form. Ano naman yung sa disulfide? Saan ito? Saan nyo ito naririnig? Disulfide bonds. Ano kaya ito? Saan? Sa antibodies. Doon sa structure ng antibody. Diba? Mayroong disulfide bonds. Okay, next. For tertiary. So, kaya nga tertiary, 3D conformation. Okay. So, dito naman sa secondary, papunta pa lang siya sa 3D. So, ito yung mga, alpha helix, beta pleated, and bent form. And then, ito naman, the folding pattern of protein. So, this is responsible for the physical and chemical properties. Again, kapag identity ng protein, nasa primary structure. And then for quaternary, so 2 or more polypeptide. So example na nito. Ito pala. Albumin has no quaternary structure. Bakit? Dahil isa lang single polypeptide chain. Yung tertiary nga pala, this is, di ba, dito, peptide bonds, and the second one is hydrogen bonds. The third one, or in tertiary, nandito yung van der Waals bond. Okay. So, itong mga protein structures, how do we destroy? How do we destroy protein structures? Through letter D. Anong term yun?
Denaturation.
Yes. Thank you. Denaturation. So, paano, madaming ways, paano mo ma-denature? Ano ba kapag denaturation? Siyempre, sisirain mo lahat ng structures na yan, all the way from primary to quaternary structure. So, napakadali lang naman. Heat, ang dali lang daw, no? Strong alkali. So, anything that is mataas yung pH or masyadong, mababa yung pH or exposed sa excessive temperatures. Yan. Ano pa? Enzymatic reactions. Like, for example, your, diba, yung, ito na lang, pinaka-basic, yung protein. Ano ang nag-cleave sa kanya again? Yung protease. So, kung yung protease na breakdown siya, edi magiging destroyed na yung mga structures ng protein. Ano pa? Isa pang example of denaturation method is UV light. Kaya, di ba, kapag excessive ang ating exposure kay sunlight, di ba, as in yung ibang tao na super laging exposed, hindi yung saglit lang ha, as in yung tuloy-tuloy na chronic, di ba nagkakaroon ng alterations na sa balat nila or nag-iiba na, kasi nga, nagkakaroon ng denaturation. So, nasisira yung kanilang mga protein structure sa balat. Okay, next. Next one is okay, let's go to the plasma proteins. Okay. Plasma proteins, number 1 is pre-albumin or yun nga sinasabi ko kaninang transthyretin. Kaya nga transport, thyroxine, and retinol. Retinol is vitamin A. Pero sa ibang notes, hindi lang thyroxine yung natatransport niya, including si T3. Ano nga ulit yung other term ni T3? It is triiodothyronine. Okay, ano pa? It is used to detect malnutrition and response to dietary supplementation. Ano pa? Confirms that the specimen is really CSF since it crosses more easily to the CSF. Ano nga ulit yung tawag sa barrier ng ating circulation and the CSF? What do you call that? The blood-brain barrier. Okay, BBB. So, able to cross dyan si pre-albumin. Kaya nga, diba, sa CSF electrophoresis, may pre-albumin na nag-a-appear. Okay, the second one, this is the most important. Kasi, diba, si albumin, this is the major contributor ng maintenance of osmotic pressure. Okay, so this is the most abundant, present in highest concentration, 50% of the plasma protein mass. And it is the general transport protein. Bakit? Napakarami kasing substances or even metals ang tinatransport ni albumin. Example na dyan si calcium, sino pa? Si magnesium, sino pa? Si B1. Sino si B1? Si unconjugated bilirubin. Okay, and yun nga, nakalagay dyan. It maintains osmotic pressure. And then it is a negative acute phase reactant. So acute phase reactants are proteins that either increase or decrease when there is inflammation. So in this case, si albumin, it's a negative acute phase reactant. Sino pang kasama ni albumin? Hindi lang yan si albumin. Sino pa? Albumin,
Transferrin.
transferrin. By the way, what is the other? Okay, what is the other term for transferrin?
Siderophilin.
Okay, siderophilin. Ano pa? May dalawa pa. Ano kaya yun?
Pre-albumin.
Okay, kung si albumin, kasama siya sa negative phase, isama na din natin si pre-albumin. And the fourth one is ano kaya? Anti-thrombin 2. Yan. Sila yung apat na acute phase reactant. By the way, share ko lang no, nung kami yung third year dati third year or fourth year, parang ang natuturo pa lang sa amin nun is albumin and transferrin. Tapos, nito na lang na dinagdag tong pre-alb and antithrombin. I'm not sure kung kung kailan talaga siya. Baka na-miss out lang dati. Pero ang pinaka tinuturo sa amin dati is albumin and transferrin. Anyway, yun lang. Okay, ano pa? Si albumin, this is the major, lahat na ng mga tungkol kay albumin, pag-usapan na natin ngayon kasi siya naman yung bida. Major protein in urine. Si albumin. Ano pa? Si albumin, it is an indicator. Sige, bura-bura ko din yung iba para masulat ko. Okay pa ba tayo, guys? Okay pa? Okay pa kayo? Okay pa ba? Okay pa kayo? Hello? Sorry, hindi ko makikita yung mga reacts nyo ha, kung nagre-reacts man kayo kasi basta masisira yung flow ko dito pag masyado pa ako madaming pinindot. Anyway. Okay, si albumin, it's an indicator of nutritional status. Siyempre, si pre-albumin, di ba, all about nutrition din. Kasama din si albumin doon. Nutritional status. Ano pa? This is also a sensitive and prognostic marker ng ano kaya? Marker of yung may symptoms na diaphoresis. Ano kaya yun? Na pwedeng i-cause ni Pseudomonas aeruginosa and Burkholderia cepacia.
Cystic fibrosis.
Ano kaya yun?
Fibrosis po.
Cystic fibrosis. Okay. Okay, if mababa si albumin, in cases ng hypoalbuminemia, ano kayang magiging consequence of low osmotic pressure since siya yung nagko-contribute or major contributor ng osmotic pressure? Anong mangyayari sa patient? The patient will become matus. Kasi nga, si albumin, ito ha, baka kasi hindi nagigets ng iba, memorize ng ano to, maintains osmotic pressure, pero hindi naman nagigets kung ano ba yung principle or concept ng osmotic pressure. Ito, paliwanag ko saglit. So, ang ibig sabihin nito, that albumin maintains osmotic pressure. Ibig sabihin, di ba sa loob ng isang, di ba, ito yung inyong vein, yung inyong blood vessel. Yan. Tapos nandito yung blood, tapos ito yung lahat na. So, syempre, nandito si albumin. Si albumin maintains osmotic pressure. Ibig sabihin, hinohold niya yung liquid within the blood vessels. Kaya nga may osmotic pressure. This is the opposing force to capillary filtration since it pulls the water into the capillary or yung sa blood vessels nga natin. This is assuming that albumin is normal. Normal yung value. Yan talaga yung function niya. But when albumin is decreased, mababa na, wala nang nag-hold sa osmotic pressure. Now, what happens to the fluid? Kung wala na nag-hold sa kanya into the blood vessels, 'di ba si-seep out or magkakaroon ng interstitial fluid dito sa labas ng ating tissues, seep out na siya. So ano mangyayari? Ito yung sinasabi nating edema, namamanas. Kasi 'di ba yung edema pag prines mo or pininch mo yung muscle or yung legs kunyari, 'di ba? Hindi naman siya agad-agad bumabalik na hindi siya nagba-bounce. So 'yon. I hope na gets ng iba yung concept ng osmotic pressure na to and hindi lang basta sinasaulo. Okay? Ano pa? Ito, meron pa tayong tinatawag na discuss ko na din. Hydrostatic pressure. Anong pinagkaiba niya? Kapag hydrostatic pressure, smaller size of efferent arteriole than afferent. Ano nga ulit yung efferent at afferent? Kapag, 'di ba, litong-lito tayo dati, alin ba dito yung away, alin yung toward? Ang palatandaan ko lang dyan, hindi ko pwedeng pagsamahin ang dalawang A, sasabog silang dalawa. So, letter E, away. Away yung aking pagkakatanda para hindi ko siya makalimutan. So, away from the blood vessel. Ito naman, toward. Okay, so smaller size of efferent arteriole than afferent arteriole, thereby enhancing ano yung mas i-enhance niya? Enhancing filtration. Kunyari, ito yung ating arteriole sa renal corpuscle natin. So, ang efferent, di ba, dito toward. So, afferent. And then, efferent. Ang sabi, ang hydrostatic pressure, smaller size of efferent. So, ibig sabihin, kung nagsa-smaller size sa dito, di ba may ano dito, may blood, yan, na nagpupunta, kaya nga afferent towards. Tapos yung efferent kasi, pag siya ay nagbukas, away na siya, away from the blood vessel kasi nga pupunta na siya sa ibang parts. So kung nag-constrict si efferent, mas mafi-filter yung mga constituents na nandito. Kaya yun yung nag-contribute sa hydrostatic pressure. And nga pala, hydrostatic pressure, pwede din siyang maging factor nito ang weight distribution or yung posture. And so this is affected by posture na ang hydrostatic pressure. Okay. And then yun iba siya kay osmotic pressure. Again, pag osmotic pressure, hinohold ni albumin yung fluid into the capillary. And kapag bumaba ang albumin, wala na mag-hold sa fluid. Ano mangyayari? Magkakaroon ng edema kasi wala na nga mag-hold. Yun, inulit ko na lang ulit para matandaan ninyo. Repetition is retention. Okay, next. Okay, albumin is decreased. So, ano yung term natin dito? Nasaan ang aking marker? Hypoalbuminemia. And then this one, hyperalbuminemia. Okay, decreased in or lowest in nephrotic syndrome. Again, si kidney na naman. Okay, pag nasira yung ating kidney, 'di ba, lalabas, mas madaling makalabas si albumin. Hindi siya marireabsorb ng ayos kasi nga tumapon na siya ng tumapon sa urine. Kaya lowest in nephrotic syndrome, ano pa? Muscle wasting disease. Ano ibig sabihin ng muscle wasting? So may mga diseases na nangyayari to na parang nag-decrease ng muscle mass kasi hindi rin mobile yung tao. So nagkakaroon ng muscle wasting disease. So anong tendency? So ito, magde-decrease ang albumin. And then renal diseases yan, kasama naman yan. Inflammation. Oh, again, bakit mababa ang albumin kapag may inflammation? Ano pa? Dito. Yan, ito, importante ito. Bakit mababa ang albumin? Again, what is our concept? Kapag may inflammation, mababa ang albumin dahil siya ay isang negative
APR.
APR. Learn to correlate ha. Yung mga sinasaulo yung concepts, i-ano nyo siya, systematically aralin nyo, and then try to correlate, bakit nga ba mababang albumin dito, bakit mataas dito, use the concepts that are being presented to you, para gets nyo, kung balibalik ta rin man yung tanong, hindi kayo mawawala, hindi kayo malilito ng mga except na yan, okay? Okay, ano pa? Liver disease. Again, saan ba majority ng protein production? Sa liver. Ngayon, kung mababa ang or kung may sakit yung liver or may disorder in liver, magkakaroon ng decreased protein production. Damay dyan si albumin. And then here, thyrotoxicosis. Ano nangyayari pag may thyrotoxicosis? Increased ang T3 and T4. 'Di ba itong mga hormones na to, this is mainly used or nagko-contribute siya sa metabolism, 'di ba, ng katawan. Sa katawan, I mean. So, increased catabolism. Yan ha, catabolism from the prefix kata. Ano mangyayari? Decreased ang albumin. Kasi nga, nakatabolize na siya. Okay, next, malnutrition. Di ba sabi ko sa inyo, isa din siyang nutritional marker. So, kung isang bata, di ba, more likely sa mga bata nagkakaroon ng malnutrition kung hindi pinapakain ng ayos, o edi lessen yung protein, di ba, ang protein, kasama dyan si albumin. So, decreased ang albumin. And then, malabsorption and maldigestion. So, kain nga ng kain, pero hindi naman ma-absorb ng katawan. So, pwedeng yun, genetic or like this disorders na malabsorption and maldigestion. Saan may malabsorption? Anong parasite? Anong nematode? Sige nga, kung natatandaan ninyo, saan kaya may malabsorption syndrome? Basta sa nematodes yun, kung hindi ako nagkakamali, sa Strongyloides stercoralis ata yun, or hookworm. Basta maalin dun sa dalawa. Anyway, correct me if I'm wrong or tandaan nyo. Yan. Pwede nyo namang i-chat sa chat box. I'm open to suggestions naman and correction. Okay. And then, ano pa? So, yun nga, no? Hindi mo ma-absorb. Bale, wala yung kinakain mo. Hindi din siya matuturn into protein ng katawan na needed for growth, repair, di ba? So, decreased albumin din yun. And then, GI losses. So, ano naman yan? Correlated yan dito. Kung may problema sa GIT, di ba? They are responsible for absorbing nutrients such as protein. So, yun. Kung may something sa GI tract na hindi maayos, so decreased ang albumin. And then burns, yan, burns. Kapag burns, nade-dehydrate si patient. If dehydrated, mababa din ang albumin. Okay. So dito, sa part na to, sa albumin decreased, dito din yung hemodilution. Dilution. And then, for hemoconcentration, saan siya? Dito sa increase, hemoconcentration. Paano ba nagkakaroon ng hemoconcentration? O ito, diploma in phlebotomy, di ba lahat kayo may ganito na? So, paano ba nagkakaroon ng hemoconcentration? So, technically, due to prolonged tourniquet application. Dapat ilang minutes lang ang tourniquet application o pang ano to, second year. Dapat ay less than 1 minute. Okay. Wait lang, medyo naglalaps pala tong aking ano, yung itong dehydrated and dehydration dito. Wait lang, i-correct ko lang to. So kapag may burn, sorry, hindi, wait. Cross out to. Pag burns ito, parang ganito lang yan. Kapag burns, syempre, nabe-breakdown. Ito, parang increased catabolism din pala yan. Ayun, kaya siya result to decreased albumin. And then dito, sa albumin increase, bakit increase kapag may dehydration? Say for example, ayan, kumbaga nako-concentrate siya. Kasi nga dito nga yung hemoconcentration, tama. Okay, so it's a relative increase in albumin. So hindi siya totally nag-increase. Mukha lang siyang nag-increase kasi nag-lessen yung fluid sa katawan. So kaya increased or hyperalbuminemia. Ang term dun is relative hyperalbuminemia. Okay. Okay, next one. Okay, number 3 ang globulins natin. By the way, what is the albumin to globulin ratio? Anyone? What is the albumin to globulin ratio? Wala, hindi na alam. Ano bang albumin to globulin ratio? Ito na lang muna. Mamaya natin yung pag-usapan. Yung total protein natin. So, total protein is equal to, ano yung kailangan mong pagsamahin para makuha mo yung total protein?
Albumin and globulin.
Albumin and globulin. Okay, so sino mas pataas na fraction dito? Si albumin. Okay, so ating globulins, it consists of alpha-1, alpha-2, beta, and gamma fractions. So, paano mo kukuha yung globulins? So, from this equation, dinerive lang yun, or transpose lang. So, globulin is equal to total protein minus albumin. Okay, elevated concentration in early cirrhosis will balance loss of albumin resulting to normal level of total protein. Yan nakalagay dyan. So, for example, this number 1 globulin natin, si alpha-1 antitrypsin. So, di ba nasa pre-eval natin to? Antitrypsin. Trypsin is a protease, di ba? So, it is an APRN glycoprotein. And siya yung pinakamadaming concentration for the alpha-1 globulin band, si alpha-1 antitrypsin. Ano yung kanyang function? So, it neutralizes trypsin-like enzymes like itong elastase. Specifically, the neutrophil elastase. And this is also the major inhibitor, yun yung sinasabi ko, of protease activity. O, wag lang basta ito sasauluhin ha. Kung siya ay major inhibitor ng protease activity or yung kung tinatawag natin na yung hyperactivity ng self-destruction of tissues, ibig sabihin kapag mababa si alpha-1 antitrypsin, anong mangyayari? Hindi ma-inhibit ang protease activity. So, magiging continuous ang self-destruction of tissues. So, yan, deficiency is seen in emphysematous pulmonary disease and juvenile hepatic cirrhosis. Yan, nasira na yung liver and then yung ating pulmonary. Yan. Yan yung kay alpha-1 antitrypsin. Okay, kailan naman siya increased? So, increased ang ating alpha-1 antitrypsin since this is an ATR. So, this is a positive ATR, si alpha-1 antitrypsin. So, increased in inflammation since this is a positive ATR. Lumindol ba, guys? Parang lumindol. Okay, next. It is also increased in pregnancy and ano pa, estrogen use or contraceptive. Okay, next one, yung ating alpha-1 fetoprotein. So this one, this is the most abundant in fetal serum. Most abundant in fetal serum, kaya nga alpha-1 fetoprotein. So this is a tumor marker, both hepatic and gonadal cancer, si AFP. Ano ba yung kanyang abbreviation? AFP. So this is synthesized by the fetal yolk sac. So going to the parenchymal cells of the liver. Okay. And then it peaks at about 13th week of gestation. Okay, ganito yan. Si alpha-1 fetoprotein, may two types ng ano yan, pathologic increase. So, yung isa ay increase, yung isa ay decrease. So, physiologic, kapag sinabing physiologic, so brought about by changes, normal changes in the human body. So, physiologic increase siya kapag yung buntis ay may twins. And then, paano naman kapag pathologic? So, yun yung hindi magandang part, diba? Yung for pathologic increase, kapag may neural, yan, nakalagay na pala, neural tube defect. Ano yung examples nun? Spina bifida and so incomplete ang formation ng spinal cord and ano pa, anencephaly. Yung skull or yung head ng bata hindi pa kumpleto, kawawa naman. That's why kung magbubuntis kayo in the future, wag na wag niyong kakalimutang uminom ng folic acid. 'Di ba? Sa simpleng capsule or tablet, masasave niyo na yung life ng magiging future babies niyo. Again ha, wag muna ngayon, hindi pa kayo RMT, wag muna talaga. Hindi pa pwedeng buntis habang interns kayo. Okay, slight ano lang, disclaimer. Okay, so folic acid. For pathologic decrease naman, kaya nga decrease may term na kayo Down syndrome. Ano yung other term ng Down syndrome? Trisomy
21.
21.
Ano pa? Okay. And then, ano pa? Si Edward syndrome or trisomy
18.
8. Okay. So, yung ating quad marker, may tinatawag tayong quad marker. Okay, so in line din yan ng ating mga pathologic decrease. So, increased HCG, ano pa? Increased inhibin A. So, okay. Parang palatandaan lang just high. Di ba kapag nag-high, mataas, tsaka parang tinataas mo yung kamay mo. So, high HCG and inhibin A. And then, decrease naman ang urinary estriol. O, tanong, kaninong, hindi, walang iyon. Kaninong sample itong decreased ang urinary estriol? Kay mother or kay baby? Sino yung may estriol? Si mother or si baby? Si mother. Okay. Estriol. Ganito lang yan. Kapag single ka pa, estrone, tas kapag nagdalaga ka na, it's estradiol. Kapag nabuntis ka na, 3 na kayo, estriol. Okay. And then, yun, mababa yung urinary estriol, which is supposed to be, mataas siya kapag pregnant. Kasi, yung adrenal cortex ng fetus, yun yung magpo-produce ng DEAs. Yung DEAs, pwede siyang mag-penetrate through the placenta, and then yun yung lalabas sa urine ng mother na estriol. So, kasama na din yung sa kanya doon. So, yan. Kaya dapat, in cases nga ng buntis, dapat nga mataas yung estriol. Pero in cases ng pathologic effects ng decrease or increase ng alpha-1 fetoprotein, nagiging mababa yung level. Okay, next. For alpha-1 acid glycoprotein, ano yung mga tatandaan ninyo dito? This has the highest percentage of, ano yung CHO? Carbohydrate or glucose and sialic acid. So, anong other term ni alpha-1 acid glycoprotein? Orosomucoid. Ngayon, yung ating sialic acid, siya yung nagko-contribute sa zeta potential. Ano yung zeta potential? So, let me put it this way. So, ito yung mga red cells na nasa circulation natin. Ano yung dahilan? Bakit hindi sila nagka-clump with each other? Kasi, negatively charged ang ating red cells. Ang major contributor niyan, or one of the contributors of that, is sialic acid. Okay. Ngayon, sino yung nag-neutralize ng zeta potential? Paano na-neutralize ang zeta potential? Para mag-clump. Ibig sabihin, magka-clump na sila kasi nga, nasira na yung zeta potential. Sino may kayang gumawa doon? Si factor 1. Sino si factor 1? 5-brinogen. And 5-brinogen is the most concentrated coagulation factor. Okay. So, low isoelectric point, hence it is negatively charged. O, yun nga yung sinasabi ko sa inyo, due to sialic acid. So, it has a high affinity to progesterone and binds quinidine. Ano ba tong quinidine na to? This is a cardioactive drug. Cardioactive drug. Okay, ano pang tatandaan nyo dito? So this is a diagnostic tool in neonates in terms of or in cases ng bacterial sepsis. Okay, next one, we have hemopexin. So nasa term na niya, hemopexin binds the free heme. Okay, so it helps in the diagnosis of early hemolysis and it migrates in the beta region. So kung si haptoglobin ang sinisave niya ay si hemoglobin or free hemoglobin, si hemopexin naman ay si free heme. Next. Okay, group-specific globulin or the GC globulin, ito yung ating nasa pre-eval. So it has high affinity with vitamin D. Ano yung term, tawag nito? Yung other term ni vitamin D? Cholecalciferol. And then si actin, which is the vitamin D binding protein. Okay, next one, we have alpha-chymotrypsin. It binds and inactivates prostate-specific antigen. So, di ba si prostate-specific antigen, it's also a tumor marker ng ng prostate. Okay, so it may also form a part of amyloid plaques found in Alzheimer's disease. Okay. Kapag may Alzheimer's disease, so increased ang alpha-1 chymotrypsin in serum and CSF. Okay. For haptoglobin, ito na na-discuss na natin to. So it binds the free hemoglobin and it evaluates the degree of intravascular hemolysis. So kapag may intravascular, meaning sa loob ng red cells, wait lang, anong incompatibility to? ABO or RH kapag intravascular? This is ABO. Kapag extravascular, RH. Okay. So yan, syempre kung may hemoglobinuria, ibig sabihin lumabas na yung mga free hemoglobin, hindi na na-bind ni haptoglobin kasi nga decreased. Okay. Pero, in cases kaya ng rhabdomyolysis, ano ba yung rhabdomyolysis? Tama ba? Rhabdomyolysis, tama. Ano kayang level ni haptoglobin? Ang myoglobin, increase siya dito. Pero kapag haptoglobin, this is normal haptoglobin. Okay. Next. Okay, for ceruloplasmin, again, copper binding alpha-2 glycoprotein. So kung ako sa inyo, i-graph ninyo or i-table kung sino yung alpha-1, alpha-2, kung sino yung sa beta, and gamma globulins para madali na din. Okay, this is indicator for Wilson's disease. Yung mga characteristic na conditions when you have Wilson's disease. So hepatolenticular degeneration, deposition of copper in the tissues, in the liver, brain, skin, and cornea. Bakit sa tingin nyo na deposit yung copper dito sa mga ito? Again, kapag may Wilson's disease, anong level ng ceruloplasmin? Mababa or mataas?
Mababa po.
Okay, mababa yung ceruloplasmin. Therefore, kumbaga, hindi siya na-transport. Kaya, nade-deposit siya sa mga tissues. And then, kapag na-deposit siya sa cornea, anong term doon? Kayser-Fleischer rings. Okay. Pero kapag may Menkes syndrome, di ba ito yung may kinky hair appearance? Ano kayang level ng ceruloplasmin?
Mababa.
din po.
Mataas ang ceruloplasmin pero mababa ang serum copper. Okay? Okay, next one, we have alpha-2 macroglobulin. So this is the largest, kaya nga you have there the prefix macro. Largest major non-immunoglobulin protein in the plasma. It increases 10 times in nephrosis. So anything that has to do with renal diseases or like this condition, nephrosis, so increased or magkakaroon ng spike sa ating electrophoresis ng alpha-2 macroglobulin. Okay, so may side notes pa tayo dito. Ano daw yung mga nag-i-increase kapag acute and chronic. Okay, so for acute inflammation, mostly ang nag-i-increase dyan ay sino? Alpha-2 globulins. And then kapag chronic, 1 and 2. Alpha-1 and alpha-2. Again, kapag acute, si alpha-2 yung nag-i-increase. Kapag naging chronic na, sasabay na si 1 and 2. Next one for globulins, we have transferrin or siderophilin. So it comprises 90%. So ito naman yung pinakamadaming fraction sa beta globulin. And again, this is negative APR. Pansinin niyo kung sino yung mga pinakamadaming contribution, sila yung mga negative APR. So ganun katindi yung effect sa kanila. So it transports iron. And yan na nga, it prevents loss of iron through the kidney. So for example, namatay na si RBC, di ba malalize na siya or lalabas na yung mga components niya. So yung iron part ng red blood cell, i-salvage naman ni transferrin para hindi siya matapon lang sa kidney. Instead, siya ay magagamit pa for the next production ng mga susunod pang RBCs. So, babalik siya sa storage pool. Ano yung sinabi dito? The beta spike seen in, ano yung IDA, iron deficiency anemia is due to the elevation of transferrin. Okay, let's talk about this. Kapag may iron deficiency anemia, anong sabi dito? Elevated daw ang transferrin. Sa tingin nyo, bakit? Kaya nga, iron deficiency, walang iron or low or no to low levels ng iron. So, kung wala namang nababind si transferrin, di pa kalat-kalat lang siya dun sa circulation. So, yun yung nagkakos ng increased transferrin in the circulation or in the blood. Okay. Ano pa? It is an elevated level appears as paraprotein in severe IDA. Okay, next one. Okay, beta-2 microglobulin. Okay, again, it's indicator of renal tubular damage. It appears when in the urine when reabsorption is incomplete. And ito pa yung mga other things na kailangan nyo tandaan. Freely filtered and then reabsorbed and metabolized completely by the proximal convoluted tubule. And as we have said kanina, this is a light chain component ng MHC class 1. Whereas sa MHC class 2 ay alpha and beta only. Okay, next. Ay, wait lang. May information pa regarding kay beta-2 microglobulin. This has the tendency to fold into beta sheet conformation. So, nakaka-add din to or contribute din to sa amyloidosis. So, ito na nga yung sa mga patients with Alzheimer's disease. Yeah, si beta-2 microglobulin. Next, yung ating immunoglobulins, yes, they are synthesized in the plasma cells. Again, plasma cells are the most fully differentiated B lymphocytes kasi nga sila na yung nag-produce ng antibodies. Okay, so not produced to any extent by the neonate kasi nga ang formation ng antibodies ng isang baby ay kapag naging 6 months onward pa siya. Onwards. So, hindi, kaya ang mga babies, pansinin nyo, they are prone to infection kapag as in newborn pa sila kasi wala pa silang protection. And they get protection through the help of the secretory IgA. Saan yun nakakukuha ng baby? Sa colostrum or sa breast milk ng mother. Okay, so IgG is synthesized by the mother crossing the placenta. Okay, so si IgG lang yung antibody na nagko-cross ng placenta. Hindi yan kaya ng other antibodies. Okay, next for lipoprotein. There are complexes of lipids and protein. Kaya nga siya lipoprotein. So ano yung examples natin? The topics for next week, LDL, VLDL, HDL, and chylomicrons. Okay. Another thing, side notes natin. So CRP and serum amyloid A, during inflammation, they increase ilang times kaya? 1,000 times. 1,000 times increase during inflammation. Okay, wait lang. Review nga natin yung mga IgG subclasses natin. Si IgG1, IgG2, 3, and 4. Which IgG subclass can cross the placenta? Review. Alin yung may kakayahang mag-cross ng placenta?
IgG po.
Si IgG1. Ang palatandaan dito, siya nga yung number 1. Kaya siya yung nakaka-cross ng placenta. And ang magkaka-partner kasi dyan, si 1, 2, at si 3, and 4. So, si IgG2, yun yung hindi kayang mag-cross ng placenta. Okay, for IgG3 naman, review na tayo ng immunosero. Okay, IgG3 naman, this is the best IgG for complement fixation. Pero kailangan ng dalawang molecules ng IgG para makapag-fix ng complement. Di ba ang ating immunoglobulin talaga na best in complement fixation ay sino? Sino nga ulit yung immunoglobulin na yun? Or IgG subclass na yun? For complement fixation?
IgM.
IgG? IgM. Okay, si IgM. Ngayon, di ba may counterpart siya kay IgG? Isipin nyo na lang, yung 3, mukha siyang M pag binaliktad. Edi siya yung best in complement fixation. And then si IgG4, siya yung hindi makakapag-fix ng complement. Okay, review na lang din yun. Okay, for fibrinogen, ito yung sinasabi ko kanina. What is the other term? Factor 1. This is the most abundant of the coagulation factors. Diba siya nga yung nakaka-neutralize ng zeta potential. Kaya nagkakaroon ng RBC clumping. Okay, so isa siyang positive APR, meaning it increases during inflammation. Okay, so high levels may cause elevated ESR secondary to neutralization of zeta potential. Okay. And then when activated by thrombin, so ito sa HEMA2 ito, 'di ba, sa coagulation, so it forms a fibrin clot, 'di ba? Fibrinogen. And then paano siya magiging fibrin clot? Through the action of thrombin. Yan. Okay. What about your complements? 'Di ba ito yung LOCA? So for complements, anong functions niya? So cell lysis, opsonization, ano pa? Complement. Ay, ano ba yun? Ano nga yung loka yun eh. Nawawala yung C. I forgot. Ano ba nga yung C? And then A is for anaphylaxis. Okay, sabi dito, only C3 is present in high concentrations in the plasma. Okay, remember that your complements, itong opsonization or opsonin, ano yung definition nito? Opsonins are, what do opsonins do? They enhance phagocytosis. So, anong example ng complement ang pwede mag-act as opsonin? It is C3b. So, C3b together with the IgG, so pwede niyang i-coat si bacteria. Kunyari yan si bacteria, pwede niyang i-opsonize para makita agad siya ng mga phagocytes. Yun. Yun yung sinasabi nating opsonization. Okay, ano pa? Next one, for CRP. This is named after its ability to bind with the C polysaccharide of the pneumococci. So again, it's a positive APR. Di ba sinabi ko sa inyo, 1,000 times increase during an inflammation. Si CRP, pwede din siyang maging opsonin. So ano kayang pathway ng hindi complement pathway? Complement pathway ang natitrigger ni CRP. Anyone? So review, trigger niya si classical pathway. Yan. Si classical pathway. CRP bound to a ligand. Okay. Yung ating cardiac marker, as a cardiac marker, it determines risk for CAD, for coronary artery disease. And paano naman kapag early marker? Early marker for AMI, it is the high sensitivity CRP. So magkakasama yung mga yan. Bakit siya high sensitivity? Kasi in less than 1 milligram per DL, pwede na yung mag-detect ng AMI, ng myocardial infarction. So this is an early warning test for coronary artery disease, CRP. Okay, next one, myoglobin. So a small heme protein found in skeletal and cardiac muscles. So it has higher affinity for oxygen than does hemoglobin. Ngayon, kaya 'di ba yung mga incidents ng hazing, 'di ba, namamatay yung mga hazing victims kasi 'di ba syempre pinapalo ng paddle So, lumalabas ngayon yung myoglobin. And then, yung myoglobin, sobrang dami na niya sa circulation, napupunta siya sa kidney. Siyempre, dadaan naman lahat sa kidney, di ba? Ngayon, toxic to renal tubules. Kapag sobrang dami ng myoglobin, and therefore, it may cause acute kidney failure. Ayun. So, yan nakalagay dyan. Only 18 kilodalton. Di ba ang kaya ng ating kidney is 70,000 dalton or 70 kilodalton? Pero dito, myoglobin leaks from the damaged cells more rapidly than other proteins. And kaya nga siya isa sa first proteins to increase after the onset of AMI. So, pakitandaan ako ng mga onset hours nito. So, 1 to 3 hours. And then, peak is 5 to 12 hours and normalizing 18 to 30 hours. Tingnan nyo, napakabilis ng niya, so start ng increase niya. 1 to 3 hours, magi-increase agad yan kapag may AMI. Okay, next one, si troponin. So, it's an important marker for cardiac injury. Basta tandaan nyo lang si Mikal. Ayan, si troponins, they are the regulators of actin and myosin. Okay, ano ba tong mga TNC, TNI, TNT na to? Kapag TNT, okay, TNT, it is the tropomyosin binding subunit. And then TNI, ano yung TNI? Inhibitory subunit actin/actin binding unit. And then ano yung TNC? This is calcium binding troponin. Okay, so itong tatlo, they are present both in cardiac and skeletal muscles. Itong si cardiac TNT and then cardiac TNI, they are nearly absent in normal serum. Kapag absent sila sa normal serum, ibig sabihin kapag nagkaroon ng AMI, pwede silang mag-increase. Remember that itong mga proteins na ito itong Mikal. Yan, again, i-reiterate ko lang, lagi niyong tatandaan to, si myoglobin, TROP-I, CKMB, AST, and LDH. Okay. What is the specimen of choice kapag troponin I? Or anticoagulant? So, mostly ginagamit dyan ng laboratories ay EPTA or serum. Pero again, it depends sa machine na ginagamit. And then for TROP-T, for troponin T, yung heparin. Again, anong color ng heparin? Green. So, magkakatunog yan. Troponin, heparin, green. Okay. Okay, this TNC or the calcium binding troponin, yan, nakalagay na dyan. Calcium, binds calcium. Yan, nakalagay na. TNT, ano nga ulit ng TNT? Tropomyosin binding subunit. So, specific for heart and more sensitive for the detection naman ng unstable angina. And then, yan, please take note of the onset, peaks, and normalizing time, like 7 days. And then this one, yung TNI, or the inhibitory subunit, this is specific to myocardium. Kaya nga siya troponin I. myocardium. Okay, so most specific among the three. So very sensitive indicator of even minor amount of cardiac necrosis. Okay, microalbumin, it is now termed as moderately increased albuminuria. Moderately increased. And this is an early indicator of glomerular dysfunction. Yun nga yung sinasabi ko sa inyo. Ito na, 30 to 300 milligram per gram of creatinine, yan. And then, ito, clinical albuminuria, more than 300 milligram per gram ng creatinine. So, this is increased in diabetic nephropathy, fever, infection, and hypertension. Again, ano nga ulit yung laboratory, anong tawag doon natin? Laboratory management for diabetic nephropathy or patients with diabetes, di ba? Kasama dito si microalbumin. Ano pa? HbA1c and ketones. Okay, take note of these three. Okay, next one. CSF oligoclonal banding. Ano bang ibig sabihin ng oligoclonal? Presence in the CSF of 2 or more IgG, hindi IgM, IgG. Oligo, IgG in the gamma region. Again, saan ba nagta-travel, 'di ba? Sa gamma region kapag mga antibodies. So this is seen in patients with multiple sclerosis. O ano naman tong multiple sclerosis? Ano namang pinagkaibahan niya kay multiple myeloma? Sino yung autoimmune disease? Multiple sclerosis or multiple myeloma? Sino ang autoimmune disease? Multiple sclerosis or multiple myeloma? Anyone? Ha?
Myeloma.
Okay, the answer is multiple sclerosis. Okay, tandaan nyo ha, kaya nga siya multiple myeloma, may malignancy. Saan? Sa bone, kung saan nandun yung mga plasma cells. So, nagkakaroon ng hyperproduction ng mga paraproteins or yung mga M proteins. Yun yung multiple myeloma. Kapag sinabi nating multiple sclerosis, yan, IgG ang ano dyan. Bida na antibody. Pag multiple sclerosis, meron siyang antibodies against the myelin sheath. Yan. Again, huwag niyong pagpapalitin si myeloma and multiple sclerosis. Sino sa dalawa yung may Benz-Jones protein? Multiple myeloma or multiple sclerosis?
Multiple myeloma.
Sige nga. Okay, very good. Multiple myeloma. Kasi isa siya sa lumalabas, 'di ba, sa urine. And then, the BJP or the Benz-Jones protein coagulates at, ano kayang temperature? 40 to 60 degrees Celsius. Ito ha, ulit. BJP coagulates or precipitates at 40 to 60 degrees Celsius and dissolves at 80 to 100 degrees Celsius. Okay, tandaan nyo si BJP, hindi yan multiple sclerosis, yan ay sa multiple myeloma. Okay, going back. sa ating multiple sclerosis. So, positive result, more than or equal to 2 bands in the CSF, not present in serum. So again, nasa CSF lang, pero wala sa serum. What is the supporting medium and stain? Agarose gel and Kumasi Brilliant Blue Dye. Ayan, nakapag-ano na kami dati nung thesis namin, electrophoresis, dyan sa may proteomics, genomics lab dito sa LPU. So, yun. Sana matry nyo din yung ganun or gumawa din kayo ng electrophoresis na method. Okay, other disorders na merong oligoclonal banding, lahat yan may C. Encephalitis, neurosyphilis, parang yun, di ba? Ano ba ang nga yung basa dito? Guillain-Barré syndrome, and then neoplastic disorders. And then kapag ano naman, disorders with serum banding appearing in the CSF, so we have leukemia, lymphoma, and viral infection. Okay. Next. Yan. Ito ha, sa mga nakakalimot pa kung nasaan napupuntang ating mga electrophoretic pattern. So lahat sila nagsisimula sa cathode. Again, kapag wag niyong pagpapalitin ha, pag cation, this is positively charged. Kapag charged, kapag anion, negatively charged. Pero itong cathode, babaliktarin mo sila. Ang pinakamagandang palatandaan dito, na anode, kaya namatay, RIP, na anode. Yan, sabi to ni Doc Karen. Yan, na anode, kaya rest in peace, namatay. So doon, papunta sa positively charged. So the most anodic protein is albumin. Pag sinabing most anodic, the one closer to the, or the closest to the anode. E di kapag sinabing second anodic, e di itong alpha-1 antitrypsin or the alpha-1 globulins. O, yun ha. And then, ang most cathodic proteins ay immunoglobulins naman. Or yung ating gamma globulins. We term them as gamma globulins with respect to their electrophoretic mobility. Okay ha, sana malinaw sa lahat yon. Wala nang malilito dito. Kaya tingnan nyo to. This is a stain ng agarose gel. Yan, gumamit din kami ng ganyan nung thesis namin. And then, nag-Kumasi Brilliant Blue kami. So, kung sino yung may pinaka-dense, yan, pati densitometer gumamit din kami to quantify the proteins. Yan. So, kapag denser yung color, ibig sabihin, mas mataas yung concentration talaga ni albumin. O, diba? Totoo yung sinasabi sa theoretical or sa libro. And then, followed by these bands na. Yan. Next. So, yan. Example, you know, pre-albumin, nauuna siya. Albumin, and then the alpha-1. Yan. Followed by the next proteins. Okay, book muna tayo saglit ng ng 15 minutes please. Medyo lang. May kailangan lang akong Okay, let's start now with liver. Okay, so ito yung minention ko kanina na 80% of the liver must be destroyed to diminish the liver function. So in cases nga ng cirrhosis, it is already irreversible. Okay. So it is the chief metabolic organ. Kita nyo naman ang daming functions ng liver. So for synthesis, so including na dyan ng proteins and then storage, like yung glycogen natin, di ba? That is the storage form of glucose. And then conjugation. Ano ba yung nag-undergo ng conjugation? Your bilirubin. And ito, excretion and secretion. So, kasama na din doon yung bilirubin and then detoxification and drug metabolism. Nga pala, may nag-PM sa akin na student. Thank you for informing me no, regarding dun sa Wilson's disease and dun sa kinky hair. So, again, clarify ko lang, kapag Wilson's, wait lang, hindi ko magana. Pag Wilson's disease, again, decreased ang ceruloplasmin. Pero, meron talagang copper or serum copper ang patient. So, wait lang, i-write ko na lang din dito. So, decreased ceruloplasmin. Again, ceruloplasmin, this is the copper binding protein. Ceruloplasmin. And then, there are normal levels ng copper. Okay, so ibig sabihin, normal naman yung levels or normal to high levels ng copper, pero walang nagtatransport ng copper, kaya nade-deposit siya sa tissues, liver, heart, and ano pa yon, yung cornea. And then for Menkes kinky hair syndrome naman, or Menkes syndrome, parehas decreased ang ceruloplasmin and decreased din ang copper mismo or yung serum copper. So this is an X-linked recessive disorder. If I'm not mistaken. It's X-linked. Yes, let me double check. It is X-linked recessive. Yes, neurodegenerative and connective tissue disorder. Okay. Okay, principal pigment in bile is called bilirubin. Okay, later we will be discussing the step-by-step procedure ng conjugation. So, para mas maintindihan ng lahat, paano ba nako-conjugate si bilirubin? Okay, so this is the major metabolite of heme. So, approximately 250 to 350 milligrams of bilirubin ay produced in healthy adults. So, provided na walang problem in excretion or transport, so yan yung level. And then, it is derived from the turnover of senescent red blood cells. Yung matatanda ng red cells, di ba? Ang ating life cycle or lifespan of red cells ay 120 days. Yan. So, other sources ng bilirubin, we have myoglobin, cytochromes, and catalases. Okay. So, yan. These are the comparisons. So, mas maiintindihan nyo ito kapag gets ninyo yung step-by-step conjugation process. So, pero bago tayo mag-proceed doon, i-define muna natin ulit yung mga terms. So, dapat alam niyo itong mga to. So, for B1, siya yung unconjugated. Again, wag pagbalik ta rin. Pag B1, yung una muna. So, kapag una mo, siyempre, hindi conjugated pa. And then, bilirubin 2 or B2, that is your conjugated bilirubin. Kung hindi pa siya conjugated, that is water insoluble. Water insoluble. Ano ba yung nagki-carry kay B1? Or ano ba yung major transporting protein ni B1 para makarating siya sa liver for conjugation? Dahil nga siya water insoluble, kailangan siyang i-transport ni albumin. And then for bilirubin 2, that is water soluble. Kaya nga siya natin nakikita na sa color ng feces or ng urine. And then, since it is insoluble, it is non-polar, and kung sino yung polar, that is bilirubin 2. Kapag indirect bilirubin, ayan, di ba, yung may total, kapag nakikita nyo sa laboratory, may nagre-request ng indirect bilirubin or direct bilirubin. Kapag indirect, so di ba, lahat ng may mga prefix na not, on, in, non, lahat yan si bilirubin 1. Ayan, di ba, mapapansin niyo. And the other term here is hemobilirubin. Probably because siya yung pinakauna na nare-release kapag nag-breakdown na yung hemoglobin. So, kaya hemobilirubin. A clue na lang or parang palatandaan para sa inyo. And then, cholebilirubin naman for bilirubin 2. Since siya ngay unconjugated pa lang, this is slow reacting hemoglobin. And then, prompt or 1 minute bilirubin na kapag na-conjugate na siya. It's also called prehepatic bilirubin kasi nga since prehepatic, before it reaches the liver for conjugation, it is unconjugated at first. So, kaya nga siya bilirubin 1. And then post-hepatic, ibig sabihin dumaan na kay liver, na-conjugate na siya. If ever man magkaka-problem, ang magiging tawag na sa kanya ay post-hepatic or obstructive. Ibig sabihin na nagkaroon lang ng obstruction pero tapos na yung conjugation. So later we will be discussing itong mga Gilbert, Krigler, yan. Lucy Driscoll, Driscoll deficiency. This is associated with increased bilirubin 1. For bilirubin 2 naman, we have clue na yung biliary obstruction like gallstones, pancreatic cancer, yan, Devine Johnson, and itong mga nakasulat dito. Biliary atresia, hepatocellular disease. Pero ano naman yung tinatawag na delta? Delta bilirubin. This is B2 plus albumin. Okay, so it has a longer half-life of 17 days. Okay. So, nandito na ba yung ano? Okay, so jaundice, it comes from the French word, I don't know how to pronounce French, jaune. So, it means yellow. So, yellow discoloration of skin, mucous membrane, sclera of the eyes. And it is a visible indication of hyperbilirubinemia. So, ano ba yung level dapat para ma-consider na jaundice? Ay, na jaundice na. Yan, nanilaw na. So, 2 or 3 milligrams per DL. And then when you say icteric ang sample. The yellowish discoloration of serum. So, kailangan mo na ma-reach yung 2 or 3 milligrams per DL ng bilirubin for it to be considered jaundice. Okay. Okay, for prehepatic jaundice, wait lang ha, double check ko lang kung nandito yung... Okay, wala pala. Parang wala dito yung ano. Wait lang ha, saglit lang. Ayun. Ayan, sige, discuss muna natin to para medyo yung mga kanina kong flinash na iintindihan ng iba. Yan. Show muna natin tong normal biosynthesis and metabolism of bilirubin. Okay, since what we have discussed, so 120 days ang lifespan ni RBC, and then ipapresent na siya for culling and pitting, di ba? Kapag naging senescent na siya. Saan yun nangyayari? Sa spleen. Ngayon, kapag na-release yung hemoglobin content, di ba, it is heme plus globin. So, yung heme, di ba, may lalabas pa dyan na protoporphyrin or porphyrin, and then iron. So, ito, mapupunta sa, kumbaga, marirecycle for the new production naman ng mga bagong red cells. Ngayon, i-recycle. Sino ang magta-transport dito? Si transferrin. And then for globin, since this is, excuse me, the protein part of hemoglobin, so mabre-breakdown siya into amino acids, and then sa amino acid pool, magiging storage naman siya for new proteins. Okay, going back kay heme, so through the help of the enzyme heme oxygenase, ma-convert siya into biliverdin. So nandito naman sa mga terms prior, yung mga magiging reacting enzymes niya, like this one. So heme oxygenase, pag na-oxygenate na yan, it will become biliverdin, the term is biliverdin, and then it will be reduced to bilirubin 1. Ang term na niyan ay si biliverdin reductase. Ngayon, kapag na-form na si bilirubin 1, take note ha, again, unconjugated si bilirubin 1. Ngayon, this part, ito, may legend naman, di ba? Sa liver. This is your liver, kunyari. Paano matatransport si B1 sa liver? For conjugation, mag-a-attach siya kay major transporter, si albumin. So, bilirubin, and then all the way, pupunta na siya kay liver. And then this is a more detailed part ha. Ang sasalubong dyan is the YZ proteins. So, dyan magbabind si B1. Ito, take note, sa loob pa rin to ng liver. And then, ipapasa niya kay ligandin. So, ang ano na natin dito, si ligandin plus B1. And then, the B1, ito ay sa liver. Sa liver pa din to ha. Kunyari na lang, kasi hindi kasya yung explanation. Okay. Again, from the circulation, going to the liver, kasama niya si albumin. And sasalubungin siya ni YZ protein, so dyan siya mag-a-attach. Next one, si ligandin. And the next one, si bilirubin 1. It will be, ano mangyayari? Doon na mangyayari yung conjugation sa ang mismong part, sa smooth endoplasmic reticulum. Doon na mangyayari yung tawag dito, yung conjugation by giving out 2-glucuronic acid through the enzyme uridyl. Ano ibig sabihin ng UDPGT?
Uridine
Ano nakalagay niya dito?
glucuronic
Uridyl.
transferase.
Okay, glucuronyl transferase. And then after that, naging B2 na siya. Yan. Yes?
Ma'am,
Miss Micah?
meron daw pong hindi pa po na-admit sa waiting room. Tapos meron daw pong mga nawalan ng kuryente.
Okay.
Thank you po.
Umuulan ba ngayon? Umuulan ba ngayon sa labas? Or hindi naman? Baka kayo nawalan.
Baka po sa ibang
Anyway.
part.
So, ito. So, okay, sige. So, ayun na nga. Nagkaroon na ng conjugation. And naging B2 na siya. Ngayon, si bilirubin 2, lalabas na siya. Ito na yung part na to. The conjugated bilirubin, dadaan siya saan? Sa bile duct. Through the help of CMOT ABC. Si CMOT ABC. I forgot the tawag nito. Yung pinaka-name nito, later we will flash it. Basta ito si ATP binding cassette. This one is, ano nga ulit yung CMOT? The, ano nga yun? Later, wait lang, sorry. I-flash natin mamaya kasi madidiscuss din naman yun. So, yung sa CMOT ABC, yan, through the help of CMOT ABC, masisecrete na siya into the bile, and then papasok na siya sa intestine. Kapag na come in contact na siya with the enterobacter, di ba? It will become your urobilinogen, and may dalawang fates, urobilinogen. So, pwede siya maging stercobilinogen, and later on magiging stercobilin. So, yun na yung magbibigay ng pigment sa stool. And the second fate is that it can enter again into the enterohepatic circulation, okay, babalik ulit sa liver, or systemic circulation. So, yan. Pwede na siyang sumama sa urine, and yun yung urobilin. So, that will give the yellow pigment of the urine. Okay, review lang tayo ng CM. Ano nga yung nagbibigay ng foul odor sa stool? Since nakita natin dito sa stool. So, we have scatol, indole, and butyric acid or butyrate. Okay, naway naintindihan ng lahat ang naging metabolism ng bilirubin. Bakit? Kasi, di ba may mga specific conditions like yung prehepatic, posthepatic, or hepatic jaundice. So, para maintindihan. Okay. Okay, going back. Okay, so going back here. Okay. So, sa prehepatic jaundice, kaya nga prehepatic before reaching the liver. So, it is also termed as hemolytic or unconjugated hyperbilirubinemia. So, what is the mechanism? So, increased amount of bilirubin being presented to the liver. Kaya nga prehepatic. So, before pa lang na makarating sa liver, increase na agad yung amounts ni bilirubin. Just like here in hemolytic anemia. Yan o, acute or chronic hemolytic anemia. Siyempre, bago pa yan makonjugate lahat ni bilirubin, ang bilirubin, di ba, napakadaming amounts ng bilirubin bago makarating sa liver. Okay, so ano yung magiging lab results niyan? So markedly decreased, of course, yung ating unconjugated bilirubin, pero normal ang ating B2. Kasi nga, di ba, increased amount of bilirubin bago pa lang pumunta sa liver. And ito, negative ang ating urine bilirubin. And increased ang urobilinogen. And then there is formation ng dark stool. And then for hepatic jaundice, ibig sabihin sa liver na mismo, the mechanism is intrinsic liver. Kaya nga sa liver na mismo yung defect. So ano ba yung examples nun? Impaired cellular uptake, defective ang conjugation, ibig sabihin baka may problem sa mismong enzyme na UDP glucuronil transferase. And then, abnormal secretion of bilirubin by liver cells. So, yun. Kaya nga siya intrinsic liver defect. In cases of alcoholic cirrhosis and hepatitis. Yan yung mga naka-red. Yan yung mga importante. So, maganda na bukod sa ma-memorize nyo yan, ay intindihan nyo bakit nangyari ito. Kaya ng hepatic jaundice sa mismong liver na yung defect. So, B1 ay increased pa rin, and then B2 ay increased din. Okay, so increased urobilinogen, and then positive ang urine bilirubin. Okay, next one, post-hepatic. Post-hepatic, so after ng ma-process ni liver, it is also the conjugated or obstructive hyperbilirubinemia. So failure of bile to flow to intestine. Ito naman, more on obstructions lang. Meron na tayong mga conjugated bilirubin, yan, kaya nga markedly decrease na ang B2, pero normal na ang B1. Kasi ano lang naman yung defect dito, sa yung mismong obstruction. So positive ang ating urine bilirubin kasi nga, kung mapapansin nyo, B2 is markedly increased. Again, B2 is water soluble. So mag-a-appear na yan kay urine. Okay, pero decreased pa rin ang urobilinogen, and then there is formation of acolic stool. Bakit may formation ng acolic stool? Hindi napasa yung stercobilin or hindi na-reduce ang stercobilinogen to stercobilin. Kasi nga may physical obstruction. Kaya na-obstruct din yung dapat na magbibigay color sa stool. Okay? Next one. Okay, so these are the derangements. Sige, puntahan na natin sila isa-isa. For Gilbert syndrome, you write it as Gilbert. Gilbert for bilirubin transport deficit. Nasa term na, transport. So there is mutation of UGT1A1 gene leading to lower enzymatic activity. So, yan, possible defect in the transport protein. Kaya nga, bilirubin transport deficit. Kung hindi siya agad matransport, di ba, tataas yung unconjugated bilirubin. Alin nga ulit ang unconjugated? Yung B1. Kasi nga, walang nagtatransport. Okay, affected individuals may have no symptoms, but they may have mild icterus. Okay, for Crigler-Nahar naman, Crigler is for conjugation deficit. Bakit siya more severe and dangerous? Kasi nga, there is multiple mutations in the UDPGT na mismo. Ito na yung nagko-conjugate mismo. So, ibig sabihin, kung wala yung enzyme na mapoproduce ng gene na iyan, edi delikado yung patient kasi mag-accumulate ang B1, ang unconjugated bilirubin. Pwede kasing mapunta sa brain kasi nakaka-pass through yan ng blood-brain barrier, yung unconjugated hyperbilirubinemia. Kaya, it is more severe and dangerous. Okay, so infants are treated by means of phototherapy. So, alam naman nating lahat na ang bilirubin ay photosensitive. So, type 1 Crigler-Nahar ay complete deficiency talaga. As in, wala nung enzyme. So, kawawa naman yung patient. And then, type 2, meron, kaso, yan, partially deficient lang siya. So, ano bang pipiliin mo sa dalawa? Siyempre, wala. Kasi parehas hindi maganda. Okay, next. Maganda dun sa magandang idea na lalo na kapag compile kayo ng notes if you're writing them down, di ba yung pre-hepatic, hepatic, and post-hepatic, pag linya-linyahan nyo lahat ng urine bilinogen, tapos ilagay nyo kung ano yung result para yun, mako-correlate nyo doon and makikita nyo agad sa isang tinginan yung notes. Okay, number 3 is Dubin-Johnson. excretion, hindi ko din alam, basta excretion, yun yung basa namin dati. Dubin excretion deficit. Impaired naman ang excretion ng B2. So, ibig sabihin na conjugate na siya, pero hindi siya mailabas. So, another problem din yun. Okay, due to the inherited, ito na yung ibig sabihin ng CMOT. Nakalimutan ko kanina, Diyos ko po. Canalicular, multi-drug resistance, multi-specific organic anionic transporter, ATP binding cassette protein. Okay, napakahaba. Ito na lang, CMOT ABCC2 or CMOT ABC. CMOT ABC. So yan, excretion. Excretion, again, paano ba na-excrete? Diba, pagpapunta na siya sa bile duct, through the help of CMOT ABC, mapupunta na siya sa duodenum kung saan nandoon yung mga enterobacter para process si urobilinogen. Okay, the blocked B2 returns to the blood and becomes, yan. Di ba si delta bilirubin, again, it is B2 plus albumin. And it has 17 days na half-life. So what is the distinguishing feature? Intense dark pigmentation of the liver due to accumulation of lipofuscin pigment. Kasi nga, ang problem lang naman dito ay yung excretion. So, na-conjugate na siya, pero hindi siya mailabas. Yan. Again. And then, rotor syndrome. So, dalawa na yung ating, for conjugated hyperbilirubinemia. It is Dubin-Johnson, again, bilirubin excretion, and then rotor, less common and relatively benign. Mali pa yung spelling ng relatively. With excellent prognosis. Same as Dubin-Johnson. Okay. So, ano yung distinguishing characteristic nito? When you compare it with Dubin-Johnson, which is the excretion deficit, walang dark-stained granules. Ibig sabihin nga, mas ayos yung prognosis nito. Yan, compared sa Dubin-Johnson. Ano ba kapag sinabing prognosis? Mas may mataas yung chance na makarecover yung patient. Okay. And then, ito naman si Lucy Driscoll. There is a circulating inhibitor to bilirubin conjugation. So, kapag na-inhibit ang conjugation, di syempre, ano ba ang magko-accumulate kapag hindi siya nag-conjugate? Di unconjugated hyperbilirubinemia. So, mas tataas yung B1. So, ganun lang. Kapag sa ulo mo, or kapag alam mo, yung step-by-step nung pinakita ko kaninang conjugation process, madali na ito. Madali na itong tandaan. Like, for example, yung sa rotor, syempre, tatandaan mo lang din yung terms. And then, kung ano yung concept niya. Like, ito, pagtabihin nyo na agad si Dubin at si rotor. So, alin dito yung mas excellent ang prognosis? Si rotor. Si Dubin, siya yung mas severe kasi meron siyang dark staining granules due to lipofuscin pigment. So, si Dubin and si rotor, ibig sabihin, sila ay conjugated hyperbilirubinemia. Again, excretion. Yun lang yung problem. Okay, ito yung example ng lipofuscin pigment sa hepatocytes. Again, ano yung terms sa parenchymal, parenchymal macrophages in the liver? Ano nga yung term doon? Cup? Per cells. Okay. Okay, another side note. Pwede nyo ding i-note to. Okay. For measuring the overall capacity to transport bile. So, saan ka dyan mag-rely? Sa serum bilirubin levels. Pero kapag overall patency of the bile ducts, saan ka magre-rely? Sa serum, bile acids, or bile salts. Overall capacity to transport bile, serum bilirubin. Pero kapag yung integrity ng bile ducts, syempre dyan dumadaan yung di ba, to form yung ating mga bile and salts, bile acid and salts. So serum, bile acids or salts. Okay. Dito naman sa Hernecterus, this is, ayan, di ba? Sabi ko kanina, ang B1, tawag nito, may capacity siya to pass through the blood-brain barrier. So, the deposition of bilirubin in the brain will cause retardation and severe motor dysfunction. So, ito yung level ha, hindi 25. Kasi at 20 milligrams per DL na nag-deposit sa brain, yun, there's danger of kernicterus. So, ano ang treatments nito? Phototherapy again, kasi nga photosensitive ang ating bilirubin, or exchange transfusion in extreme cases. Siyempre, kung papalitan yung blood mo, edi mababawasan yung mga bilirubin levels sa dugo mo, therefore, hindi na masyadong mag-accumulate sa brain ang unconjugated bilirubin. Okay, so nandito na ang kumbagay buod. So causes ng unconjugated. So again, kapag may hemolysis, edi mas madami na ngayon ang B1 kasi nga 'di ba, madaming nag-burst na cells, so mas madami ang unconjugated bilirubin. Gilbert, saan may deficit dito? Bilirubin transport. And then Krigler-Nahar is conjugation. So may deficit or problem in the conjugation, kaya nga nadami ang B1. And then hepatic disease or hepatitis. So, ayun. 'Di ba ang hepatitis or yung hepatic jaundice parehas namang mataas yung B1 and B2 kasi nga mismo sa liver na yung problem. And there are in cases of fasting, so kasama din siya sa cause ng unconjugated hyperbilirubinemia. Okay, for conjugated naman, again, ang pinag-uusapan ay direct bilirubin, hemobilirubin, hindi hemo ha, ang hemobilirubin ay si B1. Okay, ano ang problem dito? Excretion ng bilirubin 2. Saan may problem? Sa CMOT ABC. Brooker syndrome, ito yung less and more excellent ang prognosis rather than the Dubin-Johnson. Ito, isipin nyo din, Dubin-Lipofuscin. So, tunog lang. And then, biliary obstruction. Siyempre, pag na-obstruct, so septicemia, parenteral nutrition, androgen spasm, pancreatic cancer, and parasitism. In cases of what kaya? Sino yung kilala niyong parasite? I know, para may copulatory bursa, something yan. Di ba, si schistosoma japonicum? Basta, parang schistosoma species. Kasi may case kami nito dati, nung nag-case analysis kami, nung kami naman dati yung 3rd year, meron siyang obstruction sa bile duct kasi nagkaroon siya ng schistosoma from Mindoro or Palawan. Basta ganun. Okay, next one, Reyes syndrome. For Reyes syndrome, ano yung drug associated dito? Aspirin. Okay. Pero the most important drug associated with hepatotoxicity and the most commonly abused drug in the US and probably the whole world is ethanol. Okay, so ang Reyes syndrome, siya ay group of disorders. Ibig sabihin, hindi lang siya iisa na Reyes syndrome. So caused by infectious metabolic, toxic, or drug-induced disease such as ito nga ang aspirin. So, idiopathic siya, nakalagay. It's unknown, but studies found, ingestion of aspirin during a viral syndrome and subsequent development of Reyes syndrome. Okay, ano ba ito? Non-inflammatory encephalopathy and fatty degeneration of the liver. Okay, let's go naman dito sa assessment of liver function. So, yan. Okay. So, used to quantify, determine the severity of the hepatic dysfunction. So, yan. Yan yung ating mga tests. So, TPAC, yung total protein, albumin glob, and then prothrombin test. Okay. Basta naman kasi protein, kasama na siya sa nutritional status kasi nga, 'di ba? Yan talaga yung building blocks ng ating katawan, ng protein. And yeah, presence of severe diseases. Okay, 10% higher in ambulatory individuals. So compared sa mga bedridden, 10% higher. And then the plasma protein is 0.2 to 0.4 grams per DL higher than serum. Kasi nga, 'di ba, kapag serum, clotted blood. So may mga na-utilize na proteins, 'di ba? So technically, mas higher talaga yung plasma protein. Next, transadates have a total protein of, yan may heart na naman. Again, di ba may heart din kanina? Ano nga yun? The proteins appear as cations, di ba? At pH, 3 point, ano nga yun? 3 point?
5.
Okay, 3.5. Okay, so transadates, and then kapag exudate naman, more than 3 grams per DL. So, ang exudates, kailan to sinasabing exudates? When there is inflammation or yung mga pus cells, yung mga pus cells for inflammation. And then transudates, okay, AUBF, kapag increased ang blood pressure. So, one example for that. Okay, reference value natin is 6 to 8 grams per DL. Okay, increase in malignancy, multiple myeloma. Again, di ba? Si multiple myeloma, ano ba yung mga tawag sa abnormal proteins? Yung paraproteins or the M protein. Again, siya yung may BJP. Don't confuse it with multiple sclerosis, which is an autoimmune disease. Okay, increase in malignancy and Waldenstrom macroglobulinemia. Tapos ito naman si IgM mostly, ang Waldenstrom macroglob. And decreased. Yan. I think by now, alam niyo na kung paano i-distinguish or i-rationalize. Bakit ba decrease, increase? Yan. For glomerulonephritis, anything that has to do with diseases in the liver or the kidney, yan, kung mapapansin nyo, yun yung mga decreased in protein or albumin or globulin, di ba? And then for starvation, decrease din. Kasi syempre, anong pagmumula ng protein production kung hindi naman kumakain? Okay, let's go to the technicalities na part. Gel-Dal method. This is the ultimate reference method for protein concentration. Paano siya kina-quantify? Yung nitrogen lang. Gel-Dal, nitrogen, indirect method. Kaya nga siya indirect. It's not directly quantifying the protein, but through its nitrogen, kaya siya indirect. Okay? And then proteins have an average nitrogen content of 16%. So, imo-multiply mo lang siya ng 6.25 para makuha yung tawag nito, yung result. So, 6.25. Digestion of nitrogen-containing compounds. So, ito na yung process niya. To release ammonium ions. Ano ba kapag ammonium? NH4. Kapag NH3, yun yung ammonia. Using concentrated sulfuric acid. Okay, so yung ammonia, di ba, ito yung pinalabas natin, yung ammonium ions. It is measured via titration as a base or via Nesslerization. Kapag Nesslerization naman, it utilizes dimercuric potassium iodide, yung KHGI. Yan. To form a colored complex with ammonia in alkali. Sa clinical chemistry ng board exam, oo, may mga ganyan talaga. May mga method talaga na sinasama and yung mga reagents. So, kung ako sa inyo, i-compile nyo na yon sa isang index card or notes or table. Yan. So, again, Geldal, indirect. Bakit? Kasi nitrogen ang mini-measure niya. Okay, next. Okay, Biuret method, siya naman yung direct. And kung siya direct to the point, siya yung most widely used. And it is recommended by IFCC or ito, International Federation of Clinical Chemists. So ano yung principle nito? Cupric ions react with peptide bonds. Biuret, violet. Okay? Yan, ang kanyang absorbance is at 545 nanometer. Again, sa glucose, sino nga ulit yung may 400 nanometers employed in autoanalyzers? Ano nga ulit yun sa glucose determination? Anong method yun?
H-Darn.
See? H-Dorn ba yun? Hagedorn yung basa. Okay, ngayon ko na narinig yung Hagedorn. Okay, sauce naman nun. Okay, si ferric reduction or si Hagedorn daw. Sige na nga, Hagedorn or Hagedorn method. So, kaya ako natandaan siya kasi ferric, fer 100 nanometer. Okay, again, si violet, Biuret ay violet ang kulay. Siya ang direct method. Again, indirect kasi minimeasure ang nitrogen, yun ay si Geldal. It requires at least 2 peptide bonds and an alkaline medium. Pansinin nga natin pinagkaiba kay kay Geldal. Okay, ang nakalagay lang naman dito is measured as ammonia gas. Okay. Yan, ganun lang. And using dimercuric potassium iodide. Okay. Dito naman kay Biuret, 2 peptide bonds and an alkaline medium. So the sensitivity of this test is 10 to 15 milligrams per DL. Madedetect na niya. Ano ba yung reagent? So copper sulfate. So kung si glucose may copper sulfate reagent din or gumagamit ng copper reduction method, di ba? Like, ito nga, example ng reagent is a copper sulfate. Si protein meron din. This is our main reagent. Cupric ion complexes with peptide bond. Ito naman, ang asin ni Rochelle, si potassium sodium tartrate. Yan, asin ni Rochelle. PST, parang sumusut-sut lang. Asin ni Rochelle. Anong ginagawa ni Rochelle? It keeps the copper in solution. Okay, and then potassium iodide, it prevents the auto-reduction of copper. And then sodium hydroxide, kaya nga siya isang hydroxide, it alkalinizes the solution. Okay, may note pa dito. Avoid hemolysis. Ano sabi? Hemoglobin is absorbed Okay, kasi nga 'di ba colorimetric method. Kasi nga 'di ba, ano bang pino-produce ni violet? Violet. O kaya pansinin niyo, yung mga colored reactions, ayaw talaga nila na may hemolysis kasi nga nakaka-interfere. So, yan, other methods natin, refractive index, specific via copper sulfate. Di ba nakikita niyo to sa mga blood donation, yung mga blue-colored solutions, tapos ipapatak yung capillary blood. And then, kapag nag-sink down siya, it corresponds to a certain level of hemoglobin, di ba? To be discussed naman yan sa susunod na mga subjects nyo. Okay, so for turbidimetry, TCA, or trichloroacetic acid, and sulfosalicylic acid, or SSA. And then meron tayong fallen shockal toe. Di ba may fallen wu? Meron namang fallen shockal toe. Ang fallen wu ay kay glucose, fallen shockal toe is for protein naman. Okay, and then Kumasi Brilliant Blue Dye, it detects down to 1 microgram of protein. Ito nga yung ginagamit sa electrophoresis. Yan. Lowry assay used the Biuret method followed by phenol reagent. So may modification kay Lowry. Si Biuret, diba, together with other reagents plus phenol reagent, that is Lowry. Then for ninhydrin, it reacts with primary amines to produce isa na namang violet color ulit, si ninhydrin naman. Widely used for peptides and amino acids. And then for immunologic measurement, yan, by nephelometry. Ano nga ulit yon? Measurement of light scattered. Kapag light blocked, that is turbidimetry. Okay, wait lang. Balik tayo. Ang fallen shockal toe method daw is or has the highest analytical sensitivity. And the main reagent for this is phosphotungstic molybdate or phenol reagent. Yan no, di ba? Folin, phosphotungstic, phenol. Di ba doon sa folin wo, din yun? Folin wo, phospho, molybdenum blue, di ba? Tama, doon sa glucose. Okay. Pansinin nyo, puro blue sila. Okay, next one. Okay, serum protein electrophoresis. So this is introduced by Tiselius. Siya yung naka-discover niyan. So migration of charged particle in an electric field. Okay, according to their electric charge. Yan, mga points dyan. Ano yung kanyang clinical significance? So identification of monoclonal spikes and differentiating them from polyclonal hypergamma globulinemia. Again, kapag high resolution electrophoresis, that is 12 bands. Balik-balik lang tayo. At pH of 8.6, ibig sabihin base or alkaline, proteins are negatively charged. Ito yung principle mismo, tandaan na tong pH 8.6 hanggang board exam, tinatandaan pa rin yan. Okay, yan ha, wag pagbabalik rin. Kapag sinabing electrode, dun yung mismong pupuntahan via migration. Kapag yung mismong charge, ions yon. Again, pag cations, positive. Pero kapag electrode, again, na anode, kaya namatay. RIP. Okay. Yan, cathode to anode. Okay, yan. Ayan. Okay, so the fastest or the most anodic is albumin, most cathodic is gamma glob. Okay, if present, ang pre-albumin, kaya nga pre-albumin, it is ahead albumin. Okay, take note of the compositions of the alpha-1 globulins. So 90%, di ba, si alpha-1 antitrypsin. Again, this is a serine protease inhibitor or protease inhibitor. Kasi, di ba, mataas na dyan yung neutrophil elastase, and kapag may flat curve kay antitrypsin, more likely pwedeng may juvenile cirrhosis or emphysematous pulmonary Okay. Okay, for alpha-2 globulins, we have CHA. CHA squared, CHA, alpha-2. Alpha-2, ceruloplasmin, haptoglobin, and alpha-2 macroglobulin. Okay, for beta-globulins, isama nyo dito sa huwag nyo kakalimutan si fibrinogen. Okay, so 90% comprised by transferrin, yung ating beta-globulins. So, hemopexin, IgA, take note ang beta-gamma bridging, kaya nagkakaroon kasi pansinin nyo, nandito si IgA. And then beta-2 microglobulin, complements, and antithrombin 3. So ang ating gamma globulins, so sila din yung immunoglobulins. This is due to this term is because of their migratory pattern. So kasama sa si CRP sa gamma globulins. So may portion ni CRP or other portions or CRP substances or protein ay nagta-travel din sa gamma globulins. Okay, so this is the normal SPE pattern. Dapat nga medyo pa dito medyo laid out pa. Kasi mukhang mataas yung yung gamma globulin. Okay, so take note of the stains. Bromphenols, Poncho S. Amido, black, Lissamine green, Kumasi, brilliant blue. Yan yung sinasabi kong densitometer. They are scanned to quantify the amount of proteins on each band. So, kung gaano ka-dense yung kulay ng isang protein, ganun din yung kanyang value. Okay, so this is the normal SPE. So, kung mapapansin nyo, ito yung anode. Diba yung most anodic is albumin? Okay, so normal. Okay, ito, isa sa clinical significance ng protein electrophoresis, tall spike of gamma glob in case of multiple myeloma. Pansinin nyo yung height niya, napaka tawag nito, steep, napakataas. Kasi, tawag nito, isa siyang monoclonal spike. Okay. Ano pang kinakos ni multiple myeloma? Since this is malignancy, okay, hyper, ano kayong tumataas na electrolyte? Hypercalcemia. Bakit? Kasi 'di ba kapag may malignancy, kunyari 'di ba sa bone, kaya nagkaka-hypercalcemia. yung calcium dito galing sa bone yan. Kung merong malignancies, di ba nagbe-breakdown yung bone, di ba yung sa osteoclasts? Kasi nga, nasisingitan siya ng mga cancer cells or malignant tumors. So, ano mangyayari? Maapektuhan yung bone. Di ba yung bone is made up of calcium? So, madedegrade yung ibang portions ng bone and then lalabas din si calcium. Kaya nga, hypercalcemia sa bone siya mapupunta. So, it's another marker or parang minomonitor din ang calcium levels ng isang taong may malignancy, lalo na kapag nasa bone. Okay? Ito, alpha-1 antitrypsin deficiency. So, there is a flat curve naman dito. Again, excuse me. Again, this is for the cases of juvenile cirrhosis and yung emphysema. Ito, decreasing albumin, increasing alpha-2 and beta globulins. Okay, in cases of nephrotic syndrome, since lumalabas yung albumin, di ba, sa labas ng katawan through excretion in the urine. So, bumababa yung albumin. And then, increasing naman ng alpha-2 and beta globulins. Tandaan ninyo, di ba yung alpha-2 macroglob? It is increased in cases of nephrosis. O, di ba? So, ano sila? Congruent sila dun sa concepts. So, yan. Nag-i-increase yan together with the beta globulins. Kasi nga, madami dito mga positive APRs. Okay, ito naman, cirrhosis. Beta-gamma bridging due to increased IgA. Di ba ang IgA, nasan nga daw ulit? Nasa beta region. And this, ito mostly caused by ano to? Alcoholic origin. Yan. Itong beta-gamma bridging. Kasi nga, di ba, isa din siyang tawag nito, isa siyang immunoglobulin. So yan, may beta-gamma bridging. Seen in cases of alcoholic cirrhosis. Yan, again, yung result. Okay, inflammation. Yan, tumaas lahat ng alpha-1, alpha-2 together with the beta because of increased APRs. Next. Ayan, hypogammaglobulinemia. Again, gamma globulins are immunoglobulins. So, kapag may AIDS, ano pa, lahat ng mga diseases with immunodeficiency or mga immunocompromised, di ba? May mga ganyang klase ng diseases, they have flat curve dito ng gamma globe. Okay, yan. Hepatic cirrhosis. Okay, pag sinabi nating polyclonal gammopathy, kita nyo, i-compare nyo sa monoclonal. Di ba? Mono, ibig sabihin, isang clone lang ng cells or yung antibodies yung tumataas. Yan, kaya spike talaga siya. Unlike dito, polyclonal, ibig sabihin marami, kaya wide yung kanyang spike. Yung wide yung pagka-increase niya compared dito kay monoclonal gammopathy. Dito naman sa immediate response pattern, di ba, bumababa yung albumin kasi nga negative APR siya, and then due to the high alpha-2 globulins, kasi diba nag-i-increase sila, yan, positive APR, yan, for immediate response pattern. Okay, delayed. Tingnan nyo, kapag delayed response pattern, ibig sabihin, medyo tumagal yung inflammation. Di ba kapag tumatagal yung inflammation, nagkakaroon na ng association or may contribution na and tumutulong na dyan ang inyong mga gamma globulins or inyong mga antibodies para maano na yung infection. And then this is for nephrotic syndrome, again, mababa. And then mataas due to alpha-2 macroglobulins seen in increased in nephrosis. Okay, hypogammaglobulinemia, and then protein-losing enteropathy. So, mapapansin nyo, bababa ang albumin and gamma glob. Kaya nga, nasa term na mismo, protein-losing. Ayan, electrophoretic patterns. Yan, gamma spike. When you say gamma spike, yun yung kaninang napaka-steep ng increase. Like, for example, dito sa multiple myeloma, so mataas ang IgM. Kapag multiple sclerosis, again, yan ay IgG. Diba? 2 or more oligoclonal bands present in the CSF. Okay, yan. Emphysema and juvenile cirrhosis. Kasi nga, wala nang mag-i-inhibit ng protease activity. Okay, alpha-2 macroglobulin spike, so accompanied by decreased albumin. Yan. Okay, kapag nag-spike okay, sige. For albumin concentration, it is inversely proportional to the severity of disease. Kasi nga, of liver disease. To the severity. Okay, since this is
Ma'am?
hello. Yes?
Wala po. Wala po kayo. Hindi po kayo naka-share screen.
Ay, ganun. Alo, nag-connecting. Okay, sige, wait. Ano ba yun? Nagkaka-problema sa connection. Yan, okay na?
Yes po.
Okay, sige. Okay, albumin determination. Okay, so we have here the dye binding methods. Okay, si BCP, this is the most specific dye. Okay, ito daw si BCP and si BCG, these two are not sufficiently affected by hemolyzed sample. Okay. Si BCG naman, which is bromcresol green, this is most commonly used. This is used in automatic analyzers. In parallel with Biuret reagent for total protein. So, this is employed in automatic analyzers for serum albumin in parallel with Biuret reagent for total protein. Okay. So, ito pang mga stains na to, methyl orange and HABA, hydroxyaminobenzoic acid. Okay, we have already discussed na ito, so no need to emphasize more. Ayan, yan yung mga reason. Yan, kung naghahanap kayo ng mas, yan, nakasulat na, iintindihin nyo na lang. Yan. Ayan, yan, for burns, yan. Di ba may correction ako dito? So, increased destruction and catabolism. Okay, yung ating AG ratio, this is measured to determine if globulin is higher than albumin in serum. Kasi ano ba dapat yung ating reference value? It should be 1.3 to 3:1. Ano yung sinasabing 1.3 to 3? This should be your albumin. Normally, dapat mas mataas ang albumin, di ba? Kasi ito yung pinaka-major protein. So, increased ang AG ratio in cases of chronic inflammation, multiple myeloma, again, multiple myeloma, merong monoclonal spike or may gamma globulin spike. And then Waldenstrom, macroglobulinemia. So, globulin, mas mataas ang globulin. Ano mangyayari sa ratio? Mai-invert. So, increase ang ratio. Or increase ang globulins pala. Increase yung globulins in these cases. And mai-invert yung ratio. Okay, if globulin is, yan, kapag mas mataas yung globulin, it is the inverted AG ratio. Yan, since diba yung ating total protein kanina, 10, so ganun din yung kanyang conversion factor, it's also 10. Yan. This is a must know. For analbuminemia, from the term itself or the prefix an, this is hereditary absence to low levels ng albumin. So, inability to synthesize albumin. And then for bisalbuminemia, ano ba yung itsura niya? Pag ganun siya. Tapos, ito na yung alpha 1, alpha 2, and so on. So, bakit ba nagkakaganito? Yan. Presence of two albumin instead of a single band. It's associated with penicillin. Diba? Penicillin is an antibiotic. It's a beta-lactam drug. Okay, ito namang ating prothrombin time. Prothrombin time test or the vitamin K response test. So, ano yung kanyang clinical significance? I-differentiate niya si intrahepatic from extrahepatic. So remember that the liver is responsible for the synthesis of sino-sino nga ito ulit? Si 1972. Sino yun? Factor 10, factor 9, factor 7, and factor 2. Okay. So anong gagawin? Vitamin K is administered intramuscularly 10 milligrams daily for 1 to 3 days. Anong mangyayari kung nagkaroon na ng administration of vitamin K pero prolonged pa rin ang prothrombin time? Okay, it indicates na intrahepatic na yung disorder. Ibig sabihin, may problema na sa mismong liver kung hindi siya na-correct upon vitamin K administration. Kasi nga, ang principle nito, vitamin K dependent. So, kung normally may vitamin K na naka-incorporate, magiging normal or hindi magbi-bleed ang patient. Pero kapag nga intrahepatic, since, di ba, ang ating coagulation factors mostly ay sa liver. Kaya nga siya yung chief organ, di ba? Kasi ang dami niyang functions, si liver. Kapag naman nag-normal ang PT or ang, hindi, hindi pregnancy test, this is prothrombin time. This means that extrahepatic or pwedeng obstructive liver disease. So, hindi mismo sa liver nang galing yung problem. Okay, ano bang ginagawa ng vitamin K? Si vitamin K, it gives gamma, anong term doon? It adds gamma carboxyl group. So, yung 10972, so from positively charged, magiging negatively charged pag nagkaroon ng addition of gamma carboxyl group. Okay. So, ito isa pang reason, kaya na-correct. If mako-correct ang prothrombin time, meron clotting factors talagang na-produce, kaya lang, kulang lang sa vitamin K. Kasi nga, vitamin K dependent. Kaya na-correct after administration. Kaya, nasabing extrahepatic disorder. Kasi ano lang yan, may mga factors ka nga, pero hindi mo naman magamit kasi walang vitamin K. So, nung nagkaroon na ng administration ng vitamin K, naging normal na ang prothrombin time. Okay, so ito na yung ating diniscuss kanina. For bilirubin assays, yan, di ba ito yung commonly na mga interferences, si BHL, si bilirubin, hemolysis, and lipemia. Di ba nung pinag-usapan natin regarding sa mga reagent blank, sample blank? Okay. Fasting sample is preferred because lipemia will increase. Kasi nga, di ba, turbid na. So, it will increase the measurement ng bilirubin. Okay. Pero kapag hemolyzed samples naman, it will decrease the reaction of bilirubin with the diazo reagent. Yun naman yung magiging effect ng hemolysis. Okay, what should be done? Protect the specimen from light and process as soon as possible. Bakit? Bakit ba sinasabing photosensitive si bilirubin? Because yung isomerization or isomerization, it converts B1 to B2. So, anong mangyayari? Falsely increased yung magiging conjugated bilirubin value. So, kailangan protect from light. Kaya nga tayo, ini-store natin siya or mas maganda na covered ng carbon paper or masasalag ng amber bottle yung sunlight. So, ano pa ba yung mga photosensitive substances natin bukod kay bilirubin? We have carotene, we have vitamin A, vitamin B12, ano pa? Porphyrins, porphobilinogen, bilinogen, urobilinogen, bilinogen, and creatinine kinase. So these are the examples of photosensitive analytes. Yan. Next. Okay, again, visible echinacea occurs at more than 25 milligrams per liter. Pero sa Carnicterus, ano nga ulit yun? 20 milligrams per DL. Okay, 'di ba kaya nga dun sa table, si unconjugated bilirubin is slow reacting bilirubin and 1 minute or prompt bilirubin naman si B2. Okay, therefore accelerants such as caffeine or methanol are used to measure both direct and indirect bilirubin. Okay, kung walang accelerants, ano ba yung mga accelerants? Again, si caffeine or methanol. Only the B2 will be measured. Kasi nga, di ba, kailangang mag-react si unconjugated bilirubin, pero slow yung reaction niya, kailangan niya ng accelerants. Kung walang accelerants, edi B2 lang ang mame-measure. For conjugated bilirubin, the fraction that produced a color in aqueous solution. Okay. Ang pinagkaiba niya, kapag unconjugated or B1, saka lang siya magpo-produce ng color pag nahaluan na ng alcohol. Pero si B2, siya na yung fraction that produce a color in aqueous solution. Di ba aqueous is water and conjugated bilirubin is water soluble. Okay, diazole reactions. Ang principle nito, reaction of bilirubin with diazotized sulfonylate solution to form of colored product which is azobilirubin. Puro azo naman to. So, bilirubin diazotized, so equal to azobilirubin. Yun na yung colored product together with the conjugated bilirubin. Okay, pero pag dinagdagan mo na siya ng accelerator, 'di ba? Kapag may accelerator, mame-measure mo na si B1. So kaya nga naging total bilirubin na yung name-measure niya kasi may accelerator na. Remember, 'di ba dun sa naunang slide, kapag walang accelerator, ang mame-measure lang ay si conjugated bilirubin. Bakit? Kasi si B1 ay slow reacting. The third one, ano lang yan, dali lang. Total bilirubin minus B2 is equal to 1. Ganun lang. Parang total protein minus albumin is equal to globulin. Ganun lang din yun. Anong tawag sa reaction na ganito? Yung diazotization of bilirubin. What is that reaction? Van den Berg reaction. Okay. So, dati daw, sa urine samples lang napaperform ang diazole reaction. But, si Van den Berg, kaya nga sa kanya pinangalan yung reaction, kasi pwede nang ma-measure in serum samples, but only in the presence of accelerators. Okay, the third fraction, the delta bilirubin will react as conjugated bilirubin. Kasi nga, si delta bilirubin is B2 plus albumin. Okay. Okay, elevated siya in obstructive jaundice. Again, half-life of 17 days. Wait, there is also another term nga ulit ni delta bilirubin. It is billy protein. Okay, another diazole reaction. Yan, madami pa tayong method. Si Evelyn, si Jendrasig, may modified pa. Okay, for Evelyn and Maloy. Paano nyo ba ito tatandaan? Coupling accelerator niya. Again ha, nagigets na kung bakit kailangan ng mga accelerator, ganito, ganyan, hindi na lang basta magsasaulo. So, yun. Alam nyo na discuss na natin kanina. So, 50% methanol, Evelyn and methanol. Evelyn and Maloy, methanol, yun ang accelerator. Final reaction, pink to purple azobilirubin. Kung mapapansin nyo naman, puro purple yung nagiging kulay. Pero since babae naman ito, siguro si Evelyn, no? So, pink to purple. Yung final reaction, red at 560 nanometers. And it uses 1.2 na pH. Next. Jendrasik and Groff. For Jendrasik and Groff, this is the most sensitive and most widely used. Okay na ba ulit? Abay, nagsasalita ako. Wala palang, nakamute pala na glitch na naman. Okay. Okay, for ascorbic acid, it terminates the initial reaction and destroys the excess diazo reagent. Okay, naka-record pa ba ito? Okay, naka-record pa. Di ba kung mapapansin nyo, dun sa ating urine strips, may mga parameters tayo na nasisira or na interfere ng ascorbic acid. Di ba yung bibilang, yung blood, bilirubin, leukocyte esterase, nitrite, and glucose. So dito, 'di ba, si ascorbic acid, isa din siyang interference kasi it destroys the excess diazo reagent. Okay, final reaction, parang lagi nagsisimula sa pink. Okay, pink to blue naman, na azo, bilirubin red at 600 nanometers. Malapit na tayo, guys. Malapit na. Okay, meron namang modified. So, candidate na to. Candidate. Yung kanina si Gendrasic, siya ay most sensitive, di ba? And widely used. Dito naman si modified. So, mas pinaganda pa. Candidate reference method. Coupling accelerator. Naging ano na lang. Caffeine benzoate. Okay. And then take note of the conversion factor. It is 17.9. Okay, colorless end product. So, yun yung urobilinogen. Okay. So, na-discuss na natin to dun sa ating step-by-step conjugation. So, some urobilinogen in the stool are converted to stercobilin. So, kapag na-reduce ang stercobilinogen to stercobilin. Again, kapag may post-hepatic jaundice, diba, nagkakaroon ng acolic stool, yung term. Kasi nga, walang presence ng stercobilin. And na-obstruct yung B2. Ayan, complete biliary obstruction. Specimen for testing, so 2 to 4 p.m. sample because of alkaline tide. So freshly collected stool for fecal urobilinogen, okay? Avoid photo exposure. So the method for testing is Ehrlich's reaction. Ano ba yung PDAB? Pake sa ulo para dimethyl aminobenzaldehyde. Kapag Ehrlich, kaya nga naka-red na siya. Ehrlich is red. And ano ba yung reporting unit na reporting of result natin? It's through the Ehrlich's unit. Ehrlich's unit. So this is the reference range for urobilinogen in urine. That's for detoxification. Ammonia. Okay. From amino acid and nucleic acid metabolism. Ano bang nangyayari dito? So, yung amino acid natin, di ba, we have essential and non-essential amino acid. And then through the actions of proteolytic enzymes like pepsin and trypsin, okay, so mabe-break down yung ating amino acid and this will be absorbed by the GIT or the gastrointestinal tract. And then, yung ating broken down na amino acid, it will be transferred to the amino acid pool to form protein. And then yung ating amino acid, since this is already broken down, so it will undergo transamination or deamination. Transamination. Wherein, nagiging ammonium. And then, kapag siya ay na-process sa liver through the action of what enzyme ngayon? OCT, ornithine carbamoyl transferase. Di ba from toxic ammonium, i-convert siya ni OCT into urea. And urea, i-excrete kay kidney. Okay, may isa pang pupuntahan. Do sa transamination through the action of AST and ALT, it will become keto acids na. So yung keto acids, it will undergo the citric acid cycle, ba yung ating TCA or citric acid cycle, and thereby it will produce pyruvate, acetyl coenzyme A, and oxaloacetate. Yan. Dito din, nangyayari yung gluconeogenesis. Di ba ang gluconeogenesis is the formation of yung glucose storage from non-carbohydrate sources. So, ito na yun. Para maging source ng glucose. See the correlation ko, keto acids, gluconeogenesis, di ba? Ito yung mga diniscuss natin last time. So, yan yung degradation ng ammonia. So, from amino acid and nucleic acid metabolism. So, also produced from the amino acid na glutamine. So, mainly glutamine, yung pinanggalingang amino acid ng ammonia. Okay, toxic compound is metabolized exclusively by the liver. And ano nga ulit yung nagko-convert from toxic ammonium to urea? It is ornithine carbamoyl transferase. Okay, clinical significance, diagnosis of hepatic failure and Reyes syndrome. Okay, we have here the increased levels, Reyes, cirrhosis, okay, acetaminophen poisoning, idiopathic hyperammonemia. Okay, so specimen consideration, smoking is a source of contamination. Magiging falsely increased yung ammonia levels. And ano pa? Yung prolonged standing. So may correlation din with the posture. What is the preferred specimen? Arterial blood. Specimen requirements, it should be heparinized or anticoagulated with EDTA. Dapat fasting ang specimen. Kept at 4 degrees Celsius, transported on slurred ice para uniform yung pwedeng slurred ice para uniform yung distribution ng coldness, di ba? And then non-hemolyzed, syempre, kasi magpo-falsely increase to. And must be tested within 20 minutes kasi pwedeng mag-falsely decrease naman kapag sobrang tagal na bago mo pre-process for ammonia. Okay, that's it for... Grabe, no? Ang dami ng slides na yun. Okay, kaya pa ba? Kaya pa ba? For NTNs, kakaunti na lang naman ito. Okay, for NTNs. Diretso na natin or mag-break pa? Parang I don't think it's the right time para mag-break. Or ano ba? Gusto niyo pa ba mag-break time? Para tapos na natin to. Kasi next week, lipids naman and enzymes.
Ma'am, CR lang po.
Okay, sige. Okay, sige. Mga 10 minutes. Break ng 10 minutes. Medyo nakakaumay din, no? Makinig ng dire-diretso. Okay, kaya natin 'tong matapos. Okay. Sige, start na tayo ulit. Okay, sorry na guys, 'no. Alam ko medyo parang boring ngayon yung ano natin, yung ating discussion. Okay, sige. Sinulat. Okay, let's head on to our NTNs or the non-protein nitrogenous substances. Excuse me. Okay, so kapag NTNs, so kaya nga non-protein, and then they are the end products of metabolism of nucleic acids. So for nucleic acid, sino ba ito? Si uric acid. And then for amino acid, we have, di ba, and protein, si ammonia and si urea. Okay. So the test for NTNs is considered a kidney function test. Okay, so let's have a quick recap about the kidney. So it is paired. So syempre kailangan by twos, di ba? Pwede naman mag-function ng isa, pero syempre mas maganda kung dalawa. Okay, it's bean-shaped organ located retroperitoneally. Okay, so each kidney may 1.5 million nephrons. Di ba yung nephrons, yun yung functional unit ng kidney. And it receives approximately 20 to 25% of the total cardiac output. For the kidneys, okay, this is the organ na
Kaya siya,